Good morning, Ministers, Excellencies. Before we resume agenda item 14, proposed resolution and decisions, also called conference papers, have been uploaded on the Regional Committee web portal. These were prepared by the rapporteurs. We will consider the proposed resolution after lunch break today. After coffee break today. Another point to note, interpreters would very much appreciate receiving copies of your intervention in advance. These don't need to be final version, even draft are helpful. WePro RCM at who.int. We will now continue our consideration of agenda item 14, and based on yesterday's list of remaining speakers, please speak slowly and directly into the microphone. I now call upon Micronesia. You have the floor, followed by Japan. Thank you.
Thank you, Mr. Chair, and good morning to all. FSM acknowledges that progress in health and access to essential health services have not benefited all equally. Geography, population demographics, GDP all contribute to the challenge of reaching the unreached. And countries continue to push on with universal health coverage, investing in promoting health, preventing and eliminating diseases, and reducing morbidity, mortality, and disability due to health issues. It is imperative, therefore, that consultation and engagement take a whole of community approach to pursue progress. Participation and involvement of key stakeholders, the vulnerable groups such as women, children, youth, the aged, persons with disability, and traditional and faith communities are important considerations. FSM is investing in developing dispensaries or community health centers in the hard-to-reach communities in the coming days. In that process, we are consulting with stakeholders and grassroots groups. Any support from WHO and partners with skilled human resources would be welcome and greatly appreciated. FSM believes that digital health and technology are valuable tools to build health literacy, to provide essential health services, and to reach the unreachable. Therefore, the health sector must find ways to accelerate the contribution of the telecommunications sector on health, and in particular, on reaching the unreached. FSM fully supports and endorses the draft regional framework for reaching the unreached in the Western Pacific 2022 to 2030. Thank you.
Thank you, Micronesia. Japan, you have the floor, followed by Lao PDR. Thank you.
Thank you, Mr. Chair. Good morning to all. Japan would like to express its sincere appreciation to WHO for its efforts on this challenging task. First, Japan acknowledges that reaching the unreached is a critical task globally as well as to WPRO, and would like to support raising this issue as an item for regional committee meeting. Second, Japan appreciates the proposed framework is well structured, which states that 3 key areas of health sector action are to be approached from 5 key action domains, and that how such approaches should be taken by country, subnational, regional, and the unreached community levels, respectively. Japan would like to note that comprehensive approaches involving multi-governmental sectors are necessary. Third, Japan agrees that health system fragmentation causes unreached population. Japan would like to request WPRO to explain the relationship between the proposed framework and other existing regional frameworks, including public health uh, PHC regional framework, and how WPRO would achieve the vision so that each member state could introduce more practice policies. Fourth, Japan would like to highlight concern that emerging digital health technologies may leave elderly people unreached. Japan would also like to know that loneliness and social isolation should be considered in addressing unreached population. Finally, Japan would like to emphasize that universal health coverage could not be achieved without reaching the unreached, and that further regional cooperation is important to strengthen health systems that address multiple dimensions, ensuring the quality of health services. I thank you, Mr. Chair.
Thank you, Japan. Lao PDR, you have the floor, followed by Malaysia. Thank you.
Thank you, Chairs. Over the previous 2 years, Lao PDRs has been actively engaged in supporting the developments of the WPRO draft frameworks for reaching the unreached. It has presented a significant opportunities to review our progress and to identify gaps and improvements for incorporation into future's work plan. I'm happy to report that Lao PDR has made progress in improving health and service deliveries to hard-to-reach populations. This is reflected in reductions in maternal and child mortalities, reduced prevalence and several communicable diseases like malaria and TBs, and improved access to sanitation and drinking waters. Unfortunately, despite successes, some diseases have remained persistent, while others have emerged. Recognizing that progress has not equally benefited all, to reach the unreached, we are using a range of health systems, strengthening policies, and targeted, tailored public health strategies. We are implementing a zero-dose strategy for routine immunizations. We see under-immunized children under 5 and vaccinated via close community engagement in high-risk districts. This is backed up by geospatial data to support micro-plannings and identify areas of focus in hard-to-reach populations. In preparation for smooth financial transitions, routine immunization has been integrated into reproductive, maternal, newborn, child, and adolescent health, shifting from a silo program approach to more integrated people centers. This requires community trust in our health system. We are working on VPSC quality improvements and mainstreaming respectful care into national healthcare quality standards. Beyond this are a range of other strategies with one goal, reaching the unreached. This includes strengthening cross-sector collaborations and PSC services, dedicated community engagements, expanding national health insurance nationwide, and enhancing implementation to reduce financial barriers, aggressive targeting of high-risk malaria populations, expanded diagnostics and treatment for TB and HIV patients, using data systems that engage community and enable real-time decision-making, elimination of key neglected tropical disease. We believe that the draft regional framework for reaching the unreached in the Western Pacific provide clear directions on reaching the unreached to achieve our common goals, USC, and we support the endorsement of it. Thank you, Mr. Chair.
Thank you, Lao PDR. Malaysia, you have the floor, followed by Solomon Islands. Thank you.
Thank you, Mr. Chair. Very good morning to everyone. Malaysia takes note of the document on regional framework for reaching the unreached in the Western Pacific region 2022-2030, and the shared vision articulated that no one is left behind in achieving universal health coverage and the 2030 Sustainable Development Agenda. We are pleased to express our support for endorsement of this framework. A case in point is the development of the enhanced primary healthcare initiative in Malaysia to improve non-communicable disease care in the public healthcare systems. Malaysia is proud to mention that our national malaria elimination plan is sustainable and resilient despite the occurrence of the global COVID-19 pandemic. Currently, Malaysia is in the prevention of malaria re-establishment phase, and Malaysia will continue to strengthen strategies that have proved to be effective during the phase. The malaria certification strategies would be enhanced to reach populations known to be unreachable to ensure continuous delivery of healthcare services. Additionally, Malaysia reached its leprosy elimination status since 1994 at a prevalence rate of 0.9 cases for every 10,000 populations. Ever since, our approach to control and prevent is very targeted, that is, identifying close contacts as well as community at risk, living in identified pockets of endemicity, apart from ensuring all detected cases are given prompt, adequate, and complete treatment. Moreover, enriching the unreached innovations can make healthcare accessible and affordable for everyone. This means harnessing our smartphone penetration in the country to start addressing the urban-rural and socio-economic divide by using telehealth, virtual clinics, and remote patient monitoring to improve care without requiring the patient to attend physically. We have further empowered our primary healthcare services in leaving no one behind through the decentralization of services, thus resulting in greater accessibility. For example, in finding and treating our hepatitis C missing millions, free testing and decentralized treatment of hepatitis C virus nationwide was scaled up from just 25 government health clinics in 2019 to 390 thus far in 2022. The program has expanded to include prisons, community care, drug rehabilitation centers, and a health facility for refugees. Malaysia is grateful to the strategic and effective public-private partnerships and with NGOs that we have in reaching the unreached. Thank you.
Thank you, Malaysia. Solomon Island, you have the floor, followed by U.S. territories. Thank you.
Thank you, Honorable Chair, honorable delegates. As a small developing state with many scattered islands, the need to reach the unreached is an ongoing reality and challenge that Solomon Islands continues to grapple with. As our population grows and the demand for better health care increases, we still have large communities living in remote islands where there are no airports and where ships would normally reach them after 3 to 6 months on an annual basis. This makes the provision of healthcare and health delivery of goods and social services challenging and expensive. We noted in the draft framework some of the reasons why a certain proportion of the population may be unreached and the issue that could exacerbate or help mitigate the risks. One important lesson identified from the COVID-19 experience is that certain well-intended public health interventions to prevent community transmissions can also penalize people of low socioeconomic status, children, people with chronic diseases, and those with physical disabilities from accessing basic health care services. The pandemic has also demonstrated that misinformation or lack of disseminating correct information can also prevent essential certain population groups from accessing effective public health interventions. For instance, our COVID-19 vaccination rate for the target population on 2 doses still falls below 60%. And this is largely due to misinformation circulated by influential community leaders. Finally, Solomon Islands remain committed to maintain a free healthcare policy for its citizens. Despite the growing cost of service delivery, this policy has been a key safety net for access to essential health services for the majority of our people who are still depending on the informal sector for their livelihood. We welcome and endorse the draft regional framework for reaching the unreached in the Western Pacific, which will complement existing global, regional, and national strategic policies
and frameworks to support our efforts in achieving universal health care and better health outcomes. I thank you, Chair. Thank you, Solomon Islands. U.S. territories, you have the floor, followed by Republic of Korea. Thank you.
Good morning and thank you, Mr. Chair. The United States territories strongly supports the goal of the transformation to bring a people-centered healthcare system built on primary healthcare platform designed to reach all populations. We appreciate the strategy's emphasis on leveraging commitments and having innovative engagements with the unreached communities that ensure proper care at the right time and place that is cost-effective and sustainable. The United States territories have become a melting pot with many countries represented in its population and with different beliefs and cultures, especially in accessing affordable healthcare and services. If we don't act now, the vulnerability of these individuals will continue to have exacerbated health conditions due to inadequate healthcare, and in times of disaster, this worsens. To ensure protection from acculturation, we must also strategize healthcare delivery and note that isn't a one-size-fits-all. Similar to how the health systems in the Western Pacific region battled the COVID-19, the health systems should use multi-sectoral collaboration and bring health to all policies and create the community connections to the unreached. As stated in the draft framework, these partnerships are an investment that is cost-effective and increases access to health and social services. In addition, these strategies ensure that unreached voices are valued in decision-making and priority setting. The United States territories strongly support the regional framework for reaching the unreached in the Western Pacific, and that the health sector alone cannot make the Western Pacific the healthiest and safest region without transforming health systems and building essential capacities for producing the changes required to reach the unreached. Thank you, Mr. Chair.
Thank you, U.S. territories. Republic of Korea, you have the floor, followed by Papua New Guinea.
Thank you, Chair. Based on the experience during COVID-19, we need to establish strategies to tackle social vulnerability and improve resilience in times of emergency. In this regard, this regional framework is greatly important. As the draft regional framework indicates, expense on health is an investment to improve health for all, and ensuring health for all is on top policy priority for all countries. Korea has also established fifth national health plan with the vision of a society where everyone lives with a lifetime health. In particular, the health plan aims at increasing healthy life expectancy and enhancing its equity across income levels and areas, and present basic principles which prioritize health when establishing both national and local community policies. Korea has continued to strive for improving access to healthcare services, which is aligned with the regional framework. Recently, in pursuant to less burden of premium on low-income household and improve equity of insurance payment system, Korea has reformed health insurance payment system. Along with that, we have lowered the financial burden from essential health services while expanding benefit coverage and reducing out-of-pocket payment. Furthermore, in order to tackle inequity in healthcare services accessibility and ensure universal access to essential health services, we have endeavored to establish adequate healthcare infrastructure. Lastly, Korea once again would like to express our support for the regional framework, and based on the framework, look forward that joint effort of Western Pacific region countries make considerable progress. Thank you.
Thank you, Republic of Korea. Papua New Guinea, you have the floor.
Excellencies, ladies and gentlemen, Papua New Guinea recognizes the importance on WHO's thematic priority on reaching the unreached in the Western Pacific region. Indeed, Papua New Guinea is a nation of 1,000 tribes, more than 800 languages, 22 provinces, and 80% of our population live in the rural areas, spread over a total of 470,000 square kilometers across the country. PNG is a challenging country to deliver health services due to its rough terrains, high mountains, big jungles, big rivers, and large maritime provinces. In its language, PNG is almost like 800 nations living in one nation with their own distinct languages, cultures, land boundaries, and to deliver health services by a government is a massive task given its resource constraints. The government delivers health services to its people through a network of 22 provincial hospitals and national referral and teaching hospitals, 18 district hospitals, 671 health centers, and 400 different health posts that are open all. Although we have about 200,400, but 974 closed due to the lack of staff and many other reasons. The population has a population of about 9.2 million people, but its health workforce is only 14,000. To operate more than 3,000 health facilities in the country, due to our working conditions in the remote areas, health workers migrate to health and remote access areas, thus making many of our populations difficult to access readily available health services. The government health service system would not have been allowed to deliver health services without the willing and able support of our Christian and Catholic health services or our non-traditional partners. They manage 47% of the health services in PNG. We're also thankful to the private partners, the NGOs, multilateral partners, UN organizations, Australia, New Zealand, China, Japan, and others for their continued support. Universal health coverage in Papua New Guinea, the motto of our new national health plan is leaving no one behind. It's everybody's business. This is in line with WHO's theme on reaching the unreached areas. Although PNG is faced with the challenges of low immunization coverage, heavy burden of TB, malaria, and others, increasing cancers and NCDs, the government of PNG and the health system is committed to reach out to the unreached pockets of population so that health services reach all our people and communities. PNG is transforming its health system by rolling out provincial health authorities as the vehicle to deliver health services and the national health plan in each province. Our services have declined quite heavily over the last 2 years because of COVID-19 pandemic, but we're putting in the effort. Thank you.
Thank you, Papua New Guinea. Are there any more interventions on this topic? If not, I understand that the following non-state actors have submitted a video statement to the committee on this agenda item. World Vision International. Secretariat, please play the video.
Honorable Chair and distinguished delegates, the draft regional framework for reaching the unreached in the Western Pacific highlights the multiple factors that create unreached populations. While the disparities in health service access and quality for ethnic minorities and the poor in this region are historic, today they are worsened by the COVID-19 pandemic, climate change, and the economic crisis. We commend the emphasis on the need to address inequities systematically and through routinely identifying and reaching the unreached populations. The central action should be to strengthen primary healthcare, especially in remote areas. This relies heavily on the dedication of health workers in challenging locations. However, the progress to make a more equal distribution of health workforce has been too slow. The maldistribution of healthcare workforce remains a significant bottleneck in many countries in the region, with rural, remote, and hard-to-reach areas often underserved. Many health workers serve without proper training, without access to water and toilet in their facilities, with incomplete equipment, and without effective supervision. This leads to high turnover of health workers in these locations, leaving poor communities without access to quality health services. We urge member states to prioritize equitable distribution of health workers by ensuring productive and safe working environments through collaboration of government, civil society organizations, and the communities themselves. Increase budget for recruitment, training, supervision, and supply chain to help the health workforce in underserved areas. Allocate health workers urgently to work in underserved remote areas by providing attractive incentives and proper workplace conditions. With 9 out of 26 countries in the region reported that they do not meet the SDG index threshold of 4.45 physicians, nurses, and midwives per 1,000 population, this is a critical issue we need to solve together to make the Western Pacific the healthiest and safest region. Thank you.
Thank you very much. All written and video statements from non-state actors and observers on this agenda item will be uploaded to the RCM webpage. As statements reflect solely the views of the NCOs concerned, it follows that statements do not necessarily reflect the views of the WHO, including its member state and secretariat. May I now call on the secretariat to respond to the points that have been made. Thank you.
Thank you, Mr. Chair. The WHO Secretariat highly appreciates the excellent interventions made by member states on reaching the unreached in the Western Pacific and for your strong endorsement and support for the new regional framework. We are grateful for the excellent collaboration of member states on the journey to development and the field testing of this framework in the region. Your contribution have ensured a strong framework applicable across the diversity of countries and areas in the region. We acknowledge the support from partners, civil society organizations, and experts to improve the quality of this framework. There was so many important comments made by member states yesterday and today, so let me summarize some of the key themes. First, we are impressed that reaching the unreached has been the priority for member states for many years, and good progress has been made. We are pleased to hear that health equity and reaching the unreached are central to the national policy in many member states. We heard some excellent examples of work to reach the hard to reach group, from the mountainous forest of Laupedia to Vietnam, to the outer island in Kiribati and Solomon Island and other Pacific Island countries, to migrant people living in the city and the indigenous population. To reach the unreached, we need to have a strong integrated health systems based on primary health care, and many member states recognize this in their intervention yesterday on the primary health care framework. We acknowledge how many countries are moving in this direction through strategies like shifting from the hospital-based care to primary health care, improving quality of care, decentralization, supporting of micro-planning, and improving capacity at local levels, improving data system, improving workforce, population, and also the supply of health commodities. The COVID-19 pandemic expedited the implementation of some of these strategies. We are also very impressed at the strong commitment of countries to engage traditionally underserved communities in the co-development and diversity of services to meet their needs and improve the health outcomes. This includes the dedicated community-led and culturally responsive primary healthcare services for Maori in New Zealand and Indigenous Australia, which empower people to lead their own solution and become active players in their own healthcare. Similarly, tribal and religious leaders and community social mobilizer was engaged in many Pacific Island countries in PNG to address many different important health issues. We commend member states for their political commitment and leadership in progressively adapt and change governance structures, law, policy, financing mechanism, service delivery models, and attitude to benefit those who currently left behind. The strategy to reduce the financial barriers to healthcare also welcome, as mentioned by Laupedia, Vietnam, Mongolia, Solomon Island, Republic of Korea, Malaysia, and many other countries. We are pleased to hear commitment to address the driver behind the health and inequity, including the social determinant of health, stigma and discrimination, and the commitment to whole of our government and whole of society approach to addressing these. WHO will continue to support member states by sharing good practice and experience between and within countries and areas on reaching the unreached as suggested by the Philippines. WHO will support the progressive improvement of data standardized and system to enhance the member state access to relevant, reliable information on unreached group and support monitoring and evaluation. There is a clear enormous capacity within our region for innovation. WHO will support member states to implement, document, and share experiences on social innovation, service innovation, and technological innovation. The framework on reaching the unreached is relevant to all the areas of the health system and to all other regional frameworks. So we are working closely with other colleagues in WHO to implement this framework in close collaboration with member states. I would like now to end my intervention by thank you all to all member states for your support and your great contribution to the framework, and we look forward to our future implementation of this important framework. I now would like to invite Dr. Raymond Hui, the Assistant Director General for the Universal Health Coverage and Communicable and Non-Communicable Diseases at WHO headquarters, to provide a global perspective on this agenda item. Thank you very much, Dr. Ren, for being with us in a very early morning in Geneva time.
Thank you very much, Dr. Hong, and thank you very much, Mr. Chair, for giving me this opportunity to speak on this very important item. I welcome the development of the regional framework for reaching the unreached in the Western Pacific, and I congratulate the WEPR for this bold initiative. I thank the member states for your invaluable contribution in developing the regional framework. I'm very impressed and inspired by the strategy and actions you have shared from your country's perspective in the deliberations, and your strong commitment to strengthening health systems with a focus on primary healthcare that reach the unreached community with quality services and intervention that need. Far too often, our health systems cannot provide comprehensive, people-centered, and integrated services needed to address the pressing health issues of our time, like the challenges of non-communicable diseases and mental health conditions, critical communicable diseases, as well as emergency communicable disease outbreak and pandemic. In many countries, health services remain accessible only to those who can go and pay for them. This means too many people, more than half the world populations, lack access to essential services. Many of these are socio-economically disadvantaged, facing stigma and discriminations, or lived in institutional or isolated settings. They are often the very people who most need high-quality health care. Yet many, if they do manage to receive care, are pushed into poverty because of catastrophic health expenditures. We are not able to achieve our ambitious health target without a purposeful focus on this left behind. We all know how COVID pandemic exacerbated health and social inequalities, and weak health systems are a liability for everyone, everywhere. Investing a ground-up systems-oriented approach tailored to specific contexts of each country's and area, as outlined in this framework, should enable us to speed up progress towards multi-disease elimination or eradication. It should enable development of a robust, integrated, people-centered health systems based firmly on primary health care that can support health and well-being everywhere across their life course. It should help countries to reduce the burden of communicable and non-communicable diseases and mental health conditions, particularly those that continue to disproportionately affect the disadvantaged. It should encourage us to consider how we can identify who is enriched and the barriers they face and how to overcome them. It should share light on social and other determinants of health that create and sustain inequalities and encourage us to actively engage with other sectors and communities to improve health outcomes through all policies and programs. It should also encourage us to learn from the experience of programs reaching the world's poorest and the most marginalized. As many peoples and delegations said, real political commitment and courageous leaderships will be required in this very important work. So I commend you for demonstrating this commitment. WHO across all three levels will continue to support all member states to reach the unreached towards universal health coverage and the sustainable development goals. I thank you very much. Now come back to you.
Thank you very much, Dr. Reminghui, for your inspiring message. We are excited to continue our journey with member states to reach the unreached group and to leave no one behind. Thank you very much all, and now I would like to hand back over to Mr. Chair.
Thank you, Dr. Hong. If there are no further comments, may I request the rapporteurs to draft an appropriate resolution. That concludes our consideration of this agenda item. Thank you very much and well done, ministers and excellencies. Can we all put our hands together to item 14? Thank you. Now we move to agenda item 10, cervical cancer, document WPR/RC 73/6. May I invite Dr. Capuano, DBM, to introduce this item. Thank you.
Thank you, Mr. Chairperson, distinguished representatives. I am pleased to present for your consideration document WPR/RC 73/6 on cervical cancer. Cervical cancer is a gender disease that kills one woman every 2 minutes worldwide. This region accounts for 1/4 of the global cervical cancer burden, and approximately 90% of that burden is in low and middle-income countries, making cervical cancer the 6th most diagnosed cancer and the 8th most common cause of cancer deaths among women in this region. The bright side is that cervical cancer is largely preventable and curable because a vaccine to prevent human papillomavirus infection, or HPV, and accurate screening tests are available. Effective primary prevention with HPV vaccination and secondary prevention approaches, mainly screening for and treating precancerous lesions, will prevent most cervical cancer. These services are best integrated in primary care as we rebuild systems while emerging from the COVID-19 pandemic. Cervical cancer prevention and control efforts have produced results. 67% of the countries and areas of the Western Pacific region have introduced HPV vaccination for girls, and 89% have cervical cancer screening programs. But these efforts still fall short of the Sustainable Development Goal targets for non-communicable disease and global cervical cancer elimination targets. We clearly have much more work to do. HPV vaccination must be included in national immunization programs, and cervical cancer screening must be an integral part of national cancer control programs. The incremental burden of cervical cancer incidence and mortality remains an ever-growing concern for the region. Without concrete and concerted actions, we risk exposing future generations to this disease and seeing an increase in late-stage cervical cancer. This pain and suffering can be avoided and must be prevented. There is a need to establish evidence-based treatment protocols and innovative treatment referral systems, including sub-regional treatment hubs. The draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region 2023-2030 provides guidance for member states to tackle these challenges, as well as to accelerate implementation of strategies aimed at eradication of cervical cancer as a public health problem. With a global strategy to accelerate the elimination of cervical cancer as a public health problem, the regional strategic framework and its recommendations, and the support of governments, societies, and stakeholders, cervical cancer can be eliminated. The Regional Committee is invited to consider for endorsement the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region 2023-2030. The Secretariat would like to show a short video on this agenda item. Thank you, Mr. Chair.
Thank you, Dr. Capiano. I understand that the Secretariat has prepared a video on this item. Please play the video.
1 in 4 women with cervical cancer lives in the Western Pacific region. Each year, more than 145,000 women are diagnosed with cervical cancer and almost 75,000 diabetes, with many of these deaths occurring in low-income countries. A coordinated response is needed, otherwise the number of cases and deaths will continue to increase. To support member states to prevent and control cervical cancer, WHO developed a new regional strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific. It recommends stepping up vaccination, increasing screening coverage, and providing timely and quality treatment as the key actions on the path to cervical cancer elimination. By acting together, a world free of cervical cancer is possible.
Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by clicking the button on your microphone if you are in the plenary, or by using the raise hand function on Zoom. Remember, you need to press the button in order to go into the queue. Thank you. Now I call upon Vietnam. You have the floor, followed by Vanuatu.
Thank you, Chair. Vietnam would like to thank and acclaim WIPRO's work on strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region 2022-2030. We clearly realize that cervical cancer in Vietnam, as well as in other member states, is increasing and is a burden to all countries. The prevention and control of cervical cancer is really necessary, especially we have the HPV vaccines, an effective weapon to prevent as well as other secondary prevention and treatment measures. The strategic framework for comprehensive prevention and control of cervical cancer in the Western Pacific region has provided a comprehensive and complete action to achieve the goal of cervical cancer control. It includes 3 strategic actions, namely HPV vaccination, early cervical cancer screening and treatment, and improvements of service access for early diagnosis, treatment, rehabilitation, and palliative care. It also identifies 3 priority activities, including health system and services strengthening, sustainable financing mechanism, advocacy, health education, communication, and community engagement. The strategy, if endorsed, will be critical for member states to apply and administer necessary activity to reach the target of cervical cancer prevention and control in 2030. Therefore, we strongly support for the endorsement and dissemination of the strategic framework. The Vietnam's government has recently issued a resolution on the roadmap to add a new vaccine to the National Immunization Program for the period of 2021-2030. Accordingly to the resolution, HPV vaccine will be added to the NIP from 2026. However, the government also permits and encourage local governments where can allocate local budget for HPV vaccine to procure and administer HPV vaccine earlier. We also would like to propose that from global level, there would be a global mechanism to support low middle income countries in the new vaccine producing, including HPV vaccine, to ensure children from low middle income countries to able to access HPV vaccine, namely, to achieve the goal of prevention and control of cervical cancer in Vietnam 2022-2030. We hope that we will receive continuous support from WIPRO and WHO office in Vietnam in terms of financial and technical support, as well as low and affordable access price of HPV vaccine. Thank you, Chair.
Thank you, Vietnam. Vanuatu, you have the floor, followed by China.
Thank you, Chair. Excellencies, Vice Chair, distinguished fellow delegates. Chairman, let me start by giving you a brief situation of the cervical cancer in my country. To date, sadly, the disease is the #1 type of cancer among new Vanuatu women. Studies have found that the prevalence of the high-risk type of HPV is about 9.0% among healthy mothers, women aged 30 to 50 years. This is 1 out of every 10 women. Another screening that we conducted in 2011 and 2012 found that 21.7% of women are tested positive for the high-risk type of HPV. 28.4% tested positive for any type of HPV. Furthermore, among women under 25 years of age, the prevalence of the high-risk type of HPV was 31.7%, and any genotype HPV was 41.8%. With these statistics, Chair, we want to pledge our support for the regional strategic framework for the control and prevention of cervical cancer in our region. Vanuatu has considered this health issue as critically important for young women and girls, and I'm happy to say that we have already started to work to try and address the issues. Recently, we have re-established a national cancer registry and hope this project will cover the whole country by 2025. Given the low vaccination rate of HPV, we are working with our NGOs to assist us with our advocacy and screening programs. With this, I want to sincerely acknowledge our good working relationship with the Family Health Association Vanuatu and the Ekana Foundation Vanuatu. We will continue to advocate for HPV vaccine for young girls and will continue with our pap smear screening using visual inspection with acetic acid. Chair, our main challenges are low vaccination coverage because of the misleading information about the vaccine, and low pap smear screening using acetic acid because of the cost of the treatment itself. However, I wish to acknowledge the continued technical and financial support from WHO and UNICEF for enabling us to continue training our health workers on HPV, also for supply and basic screening supplies and materials. We would like to thank UNICEF and ADB as well for their financial contributions to allow us to reintroduce the HPV vaccination for girls aged 9 to 10 years, as we plan to cover the entire country by the first quarter of next year, 2023. In the next few weeks, we will be conducting mass training for trainers throughout the country, including our risk communication team, and identify community volunteers, stakeholders, and provincial education authority to plan for a mass campaign early next year. Chair, we look forward for the usual assistance from our partners, WHO, UNICEF, ADB, UNFPA, and DFAT as we roll out our program early next year. And once again, we want to reaffirm its support and endorsement of the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region, 2023-2030. Faftai, thank you.
Thank you, Vanuatu. China, you have the floor, followed by Marshall Islands. Thank you.
Thank you, Mr. Chair. China thanks the thanks the Secretariat for its report. The draft strategic framework for the comprehensive prevention control of cervical cancer in the Western Pacific region, which provides evidence-based advice for policies, as well as guidance for advocacy to eliminate cervical cancer. China supports the endorsement of the draft. China will continue to participate in relevant efforts, closely follow up relevant international research findings, share China's experiences, and respond to difficulties and challenges. Cervical cancer is the most common cancer in women worldwide. Since 2009, China has included the screening for rural women in the National Public Health Service program supported by central government, local government funding. Screening for women have been provided free of charge. Project coverage and population coverage have been expanding to domestic HPV vaccines, have been approved for sale and marketing in China, providing more guarantee for promoting the primary prevention of cervical cancer. In 2021, with the help of the development of healthy cities, China promoted the pilot efforts of innovative models with the elimination of cervical cancer as the breakthrough point and guided 15 pilot cities to actively explore effective models. Great achievements have been scored. However, due to the uneven development of work in different regions, there is still a big gap between some regions and the target of cervical cancer prevention control proposed by WHO. We hope WHO can continue to give us support in HPV vaccination and appropriate technologies for cervical cancer screening. Thank you, Mr. Chair.
Thank you, China. Marshall Island, you have the floor, followed by New Caledonia.
Chair and distinguished members of the Regional Committee. The Marshall Islands is a matrilineal society and traditional women are decision makers and landowners. Women are recognized for their significant contribution to the peaceful development and well-being of families, communities, and society as a whole. Fundamental values include caring for each other, respect, and partnership. But how can RMI release the capability of women who currently make up about half the population of RMI if we are challenged by the results of poor health? According to the Cancer in the Pacific research, the number of Marshallese females found with cervical cancer exceeded all the rest of the neighboring Micronesian countries. There are very high rates of cancers in the RMI, many attributable to the U.S. Pacific nuclear weapons testing program in the 1950s. 40 years after the test, the cervical cancer mortality rate for women of the Marshall Islands was found to be 60 times greater than the rate of women in the U.S. mainland. I am deeply concerned about the high incidence and mortality rate of this disease in RMI. This is unacceptable, particularly when we have the tools and means today to prevent this disease. More importantly, the RMI supports primary HPV testing for cervical cancer screening and already has the diagnostic equipment and trained staff to be able to commence PCR HPV testing on self and provided collected samples. However, we have limited accessibility to procure the required HPV test cartridges through the global market, and we continue to await the US FDA approval of these same HPV test cartridges for use for self-collected primary HPV testing. Further, RMI seeks assistance from the WHO to look into the correlation and linkages between high rates of cervical cancer and our nuclear legacy. The RMI requests WHO support to address these three scenarios as a matter of urgency. Chair, I wish to also reaffirm RMI's commitment towards the implementation of the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region. As a small island developing state, we continue to face many challenges, including climate change and the nuclear legacy. I am honored today to be accompanied by the Vice Speaker Peterson Chivas as part of the delegation, a representative of Bikini Atoll and one of many victims of nuclear testing in the RMI. We have buried many of our beloved mothers, daughters, and sisters due to cancers as a result from the inhumane nuclear testing. Now is the time to intervene and assist. Chairperson, in conclusion, I would like to express on behalf of the RMI government our sincerest gratitude and kamuldada to WHO, the government of RC Taiwan, US, SPC for their continued support towards cervical cancer prevention and awareness. Kamuldada, and thank you very much.
Thank you, Marshall Island. New Caledonia, you have the floor, followed by Kiribati. Thank you.
Merci, Monsieur le Président. La Nouvelle-Calédonie prend acte des orientations stratégiques concernant
Thank you, Chair. New Caledonia takes note of the strategic guidance provided on the prevention and control of cervical cancer in the Western Pacific region, fully endorses the draft action framework 2023-2030. Cervical cancer is the sixth most common cancer amongst women in New Caledonia, with an average of 24 new cases per year. The age group 45 to 54 is the most affected. There has been no change in the incidence rate of this cancer over the last 10 years. The government of New Caledonia implements two different programs to promote cervical cancer prevention. Since 2011, a free pap smear is provided every 3 years to all women, designed to effect tracing at no cost of this. This represents testing of 80,000 women per year. 7,400 women went through this system, which made it possible to trace 788 suspected or confirmed cases. And after 11 years of existence, this program has enabled many women, including those living far away from medical facility, to benefit from free screening pap tests. Since 2015, New Caledonia introduced HPV vaccination campaign for girls aged from 12. This campaign covers approximately 2,000 girls a year. It consists of 2 doses administered at school with the parents' consent, an interval of 6 to 13 months. The first campaign carried out in 2021 reached 51% participation rate. This rate has increased by 10% since the campaign started. These programs run in parallel to primary health care services provided throughout the country, thanks to the availability of adequate supporting medical and biological services. However, New Caledonia is currently facing the shortage of health workers. Solutions are found through cooperation and local and national levels. NC legislation now allows for HPV vaccination of boys in the framework of its regulatory institutions, and this program will start in 2023. In addition, in keeping with the best practice recommendations, NC is exploring the possibility of implementing targeted screening among women over 30 through prior HPV testing. For women under 30, the program will remain unchanged. New Caledonia legislation will be fully funded by the public budget, and I thank you for your attention.
Thank you, New Caledonia. Kiribati, you have the floor, followed by Hong Kong, China.
Fellow delegates, ladies and gentlemen, thank you, Honorable Chairman, for giving me this opportunity to share our experiences on this important topic and to confirm my country's support to the ongoing work for early prevention of this health issue. Cervical cancer is a major public health issue in Kiribati and a significant cause of morbidity and mortality. It is one of the leading causes of cancer death amongst our Kiribati women. This persists despite the existence of effective screening tools which have been shown to be highly effective globally. Cervical cancer is among our ongoing top priorities in our National Health Strategic Plan. These areas focus on maternal, adolescent, and young girls' health. The Ministry of Health and Medical Services has included improved early detection and the treatment of cervical cancer as key interventions, which complement capacity building of key health workers to carry out such work. We have recently completed the revision of new guidelines and policy for the secondary prevention through cancer screening and tertiary prevention through management of women with abnormal results. We have long-standing collaboration with KIFA, one of our local NGOs, to reach out to communities for screening. We are in the early stages of the introduction of HPV vaccination in Kiribati, targeting our young girls. We hope to introduce this next year and are extremely appreciative of the support of Rotary Australia and New Zealand, together with UNICEF, in planning for the inclusion of these vaccines to our routine immunization program. Mr. Chairman, Kiribati supports the endorsement of the framework and requests further technical assistance and support from development partners to progress cervical cancer prevention and curative interventions in Kiribati. Allow me to conclude, ladies and gentlemen, with my country's traditional blessings of Te Maori, good health, te roi, peace, Artadabamoa, prosperity to us all. Kambasindaba, and thank you.
Thank you, Kiribati. Hong Kong, China, you have the floor, followed by Japan.
Thank you, Chairman. Cervical cancer is an especially profound public health problem in our region. To tackle this disease burden, Hong Kong fully supported WHO's global call for action against cervical cancer. In Hong Kong, cervical cancer is the eighth most common cancer and the eighth leading cancer killing among women. Its incidence rate in 2019 and mortality rate in 2020 were 7.9 and 2.1 per 100,000 standard population respectively. In 2001, we established the Cancer Coordinating Committee to formulate strategy on cancer prevention, screening, surveillance, research, and treatment. With regards to survival screening, this recommendation was updated in 2021 to introduce HPV-based testing to women aged 30 to 64 as a primary standalone test or co-test with cytology. To further reduce the cancer burden and improve the patient's survivorship, we devised a multiple blueprint, the Hong Kong Cancer Strategy. In 2019, to set out clear priority and directions. One of the targets is to achieve a 10% relative increase in screening coverage for cervical cancer by 2025. HPV vaccination is our foremost primary prevention strategy, which was integrated into the Hong Kong Childhood Immunization Program. Since the 2019 and 2020 school year, through the School Outreach Vaccination Service of the Department of Health, primary 5 school girls have been provided with the 9-valent HPV vaccine free of charge. As of December 2021, the coverage rate for the first and second dose of HPV vaccine for P5 and P6 female students were 88 and 86% respectively. As a secondary preventive measure, Hong Kong launched the survival screening program in 2004, under which free or highly subsidized survival screening are offered to eligible women at government clinics. According to a local survey in 2019, 48.8% of women aged 30 to 49 reported that they have ever received survival screening. The Hong Kong government is committed to a global initiative of eliminating cervical cancer. We wish to express our gratitude to WHO's tremendous support and a visionary roadmap in this strong endeavor. On that note, we are pleased to support the strategic framework for comprehensive prevention and control of cervical cancer. Thank you, Chairman.
Thank you, Hong Kong, China. Japan, you have the floor, followed by Republic of Korea. Thank you.
Thank you, Mr. Chair. Japan appreciates the Secretariat for its report and supported the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region to 2023 to 2030. We look forward to guidance from WHO and the UPRO on how and at what intervals WHO plans to monitor the 90-70-90 targets up to 2030. Regarding prevention and control of cervical cancer, we are taking comprehensive countermeasures against health and social issues, including HPV vaccination, screening, treatment, patient support, cancer registration, education, and patient employment in accordance with the basic national plan to promote cancer control programs. Japan began public HPV vaccination in November 2010. Thereafter, reports of post-vaccination adverse events such as complex regional pain syndrome and symptoms similar to chronic fatigue syndrome raised safety concerns among the public and stakeholders, and since June 2013, we have suspended the active recommendations of the HPV vaccine. Subsequently, sufficient evidence has accumulated on the safety of the HPV vaccine, and it has been concluded that there is no direct causal relationship between the above symptoms and vaccination, and that there are no safety concerns, and we have reached the situation where we can provide an appropriate explanation to the public. Thereafter, we resumed active recommendation of the vaccine in April of this year. At the same time, catch-up vaccination for those who missed the opportunity to be vaccinated during the period of suspension of active recommendations for about 9 years has also been studied. The HPV vaccination coverage among young women in Japan is very low, but has been recovering in recent years. We will continue to promote cervical cancer prevention through actively recommendation and conducting catch-up vaccination while providing appropriate information to those eligible, and will continue to promote cervical cancer control in cooperation with UPRO and in the reference to this framework. I thank you.
Thank you, Japan. Republic of Korea, you have the floor, followed by Samoa.
Thank you, Chair. The Republic of Korea welcomed the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region 2023 to 2030. Korea believes that the framework will be able to contribute to the reduction in the burden of cervical cancer. The global burden of cervical cancer in this region is relatively high. So Korea supports that screening is vital to cervical cancer prevention and management for women. As the number of cervical cancer patients increased among the women in their 20s and 30s in Korea, we integrate the cervical cancer screening service for the women aged 20s and older into the National Health Checkup Program to improve the access to cervical cancer screening. Through this effort, the prevalence rate of cervical cancer has been reduced by 2.3% on annual average from 2007 to 2019. In addition, to prevent against HPV-induced cancer, it is important to scale up HPV vaccination. This year, Korea expanded the eligibility for the National HPV Immunization Program to adolescents aged 13 to 17 and women aged 18 to 26 for low-income groups. Korea recorded the HPV vaccination rate of 79% among female adolescents aged 20, 12, and older as of now, which was regarded as a high vaccination rate. In that regard, those HPV vaccination and cervical cancer screening program will be able to create synergy to prevent cervical cancer. Thank you, Chair.
Thank you, Republic of Korea. Samoa, you have the floor, followed by Mongolia. Thank you.
Thank you, Chair. Samoa continues to advocate on the importance of early detection of cervical cancer. The current situation of cervical cancer, particularly in low and middle income countries, is worrying. As noted, cervical cancer is the 8th most common cause of cancer deaths for women in the Western Pacific region, which accounts for 1/4 of the global cervical cancer burden. As noted, the human papillomavirus HPV vaccination is a cornerstone for cervical cancer elimination. For Samoa, with assistance from ADB, UNICEF, WHO, we have recently implemented the HPV vaccination this year, targeting the age groups of 13 to 7 years of age. HPV has now been included in the National Immunization Program and has become part of the routine immunization for children using the school-based approach. Samoa is determined to ensure that we provide the HPV vaccination as it is vital to eliminate cervical cancer in the long term. Cervical cancer treatment remains a challenge for Samoa. We are currently in the process of developing the National Cervical Cancer Elimination Strategy with the assistance of technical assistance from UNFPA, and would like to acknowledge this assistance. Samoa further requests technical assistance in the area of cervical cancer care and treatment, as well as an enabling environment for laboratory testing for pap smears. The challenging area for Samoa is encouraging our women to have regular tests, which would greatly assist with early detection of cervical cancer. Samoa is in the planning process of implementing a mass cervical cancer screening program for all the eligible female population. The Ministry of Health continues to work in partnership with our affiliated health NGOs in advocating for cancer awareness. Mr. Chair, Samoa thanks the Western Pacific Region Office for the development of a regional framework, which will assist in guiding countries at national level on strategic policy direction to advocate for the elimination of cervical cancer. Samoa acknowledges and recommends the endorsement of the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region, 2023 to 2030. Thank you and Faafetai.
Thank you, Samoa. Mongolia, you have the floor, followed by Australia. Thank you.
Thank you, Mr. Chair. First, excuse me. Mongolia welcomes the draft regional strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific 2023-2030, as cervical cancer remains a major public health problem in Mongolia, accounting for 7.2% of all registered cancer cases in the country. It is the fourth most common cancer among the population, the second most common cancer among women, and the third leading cause of death among women in my country. From the annual health statistics, it can be seen that the cervical cancer morbidity decreased slightly. However, the mortality tended to increase over the past 18 years. According to the statistics of the National Cancer Center, approximately 17% of the new cervical cancer cases are identified through screening program, which means about 1 in 7 new cervical cancer cases are diagnosed through early screening, and 63% of those cancer cases diagnosed through the screening program are found in early stages. Despite human papillomavirus being largely responsible for more than 99% of the cervical cancer cases, the 5-year survival rate for cervical cancer remains at around 56% in Mongolia. Mr. Chair, between 2018 and 2022, Mongolia progressed in various areas of cervical cancer prevention and control by implementing its National Action Plan on Cervical Cancer Control. These include an updated national guideline for cervical cancer diagnosis and management following the WHO comprehensive guidelines for the cervical cancer control, piloting of care HPV testing among women aged 30, 35, 40, and 45 as a preparation to introduce HPV-based screening in addition to the current cytology-based screening. And we have conducted the cost-effectiveness analysis for HPV vaccination, preparing for the inclusion of the HPV vaccination in our national routine vaccination schedule. In August, the Ministry of Health submitted an amended draft of the law on immunization, which includes HPV vaccination in the National Routine Immunization Program, to the Ministry of Finance and relevant ministries seeking legal and budgetary opinions. Once we finalize the procedural requirements, the government will be able to submit the amended law to the Parliament for ratification. Mr. Chairperson, Mongolia is fully committed to continue our work towards the elimination of the WHO global strategy to accelerate the elimination of cervical cancer as a public health problem. And on this note, we welcome the endorsement of the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific. Thank you.
Thank you, Mongolia. Australia, you have the floor, followed by New Zealand.
Thank you, Chair. Australia acknowledges the burden of cervical cancer in our region and need for accelerated action in prevention, screening and management. We are pleased to endorse the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region as an evidence-based pathway to accelerate action across the 3 strategic actions for cervical cancer elimination. The framework recognises that Australia is on track towards eliminating cervical cancer as a public health problem. Australia is on track to be one of the first countries in the world to eliminate cervical cancer by 2035, thanks largely to the combination of the National Cervical Screening Program and the human papillomavirus vaccination. The tools to eliminate cervical cancer as a public health concern vaccination, screening and treatment of pre-cancer, early detection, prompt treatment and palliative care already exist. The next critical step is to scale up their implementation. Interventions need to be appropriately tailored to domestic and local contexts, particularly in relation to scaling up HPV vaccine delivery, screening and treatment. We support the recommendation of the WHO Strategic Advisory Group of Experts for immunisation of a one-dose human papillomavirus schedule to reach 90% vaccination target against HPV by 2030. We welcome further advice from the Secretariat on any potential risks and related mitigation strategies for member states in our region in the transitioning to a one-dose schedule. Universal access to sexual and reproductive services is critical to cervical cancer prevention and control. Australia welcomes the framework's strong recognition of sexual and reproductive health and rights, gender and equity, and encourages continued consideration of barriers to access health services, particularly in remote areas and populations, including the equitable distribution of qualified health workers, especially in hard-to-reach and underserved areas. The framing of HPV as an STI could also be strengthened to recognise that disassociation further perpetuates and continues to drive the stigma and discrimination around STIs. Australia emphasises the need to ensure alignment with the ongoing work at headquarters, including the global strategy to accelerate the elimination of cervical cancer as a public health problem. Thank you.
Thank you, Australia. New Zealand, you have the floor. Thank you.
Thank you, Mr. Chair. Tēnā koutou katoa, good morning, colleagues. Aotearoa New Zealand endorses the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region, and thanks both Wipro and our fellow member states for their input into its development. We particularly support the draft framework's emphasis on strengthening action across vaccination, screening, and treatment. This three-pronged approach allows us to use all the tools available to improve outcomes and reduce inequities around cervical cancer. Since 2019, New Zealand has had a dedicated cancer control agency, Te Aho o Te Kahu. The agency provides leadership and oversight of cancer control by applying a whole-of-system and cross-cancer approach. Working alongside them is our National Cervical Screening Program, which focuses on early detection of the precursors to cervical cancer. In Aotearoa, New Zealand, HPV vaccination is delivered through schools and is free for ages 9 to 27. However, challenges in vaccination uptake remain, including due to the perceived links between vaccination and early sexual activity and infection with HPV. We know this is a common issue across the region, and we encourage the World Health Organization to continue developing health promotion messages to address this misconception. Like many member states, the impacts of COVID-19 have led to a decrease in cervical screening coverage, particularly amongst Māori and Pacific women, who already face greater barriers to screening than the general population. To counter these inequities, Aotearoa New Zealand is implementing HPV primary screening, including the option of self-testing with clinical oversight to ensure greater uptake and early detection and treatment. Chair, the opportunity to eliminate cervical cancer is within sight for us and for our region. The challenge is to ensure that strategies and plans are adequately funded and implemented, especially for communities that experience inequities and are underserved by the status quo. Ngā mihi nui, thank you.
Thank you, New Zealand. Ministers, Excellencies, ladies and gentlemen, it is now time for our coffee break. Be back in the room at exactly 10:45. 10:45, we'll have our mobility break. Mobility activities. And after that, we will consider the draft resolution on NCDs and primary healthcare. Thank you. Thank you very much and welcome back. That was a good mobility break. We also learned how to defend ourselves. We will now consider draft resolution on item 12, non-communicable diseases, and item 13, primary health care. The first proposed resolution, WPR RC 73, conference paper number 1, is on non-communicable disease prevention and control. And may I call on the English rapporteur to read the resolution with amendments from the draft uploaded in the web portal. Thank you.
Thank you, Mr. Chair. I am pleased to present a draft resolution on non-communicable disease prevention and control. The resolution already reflects all amendments suggested. In addition, the French rapporteur and I have tried to reflect any concerns commonly expressed by member states, both in the plenary session and online, in the draft resolutions. Now, I will read the resolution. WPR RC 73 conference paper number 2, 27th of October. Oh, hold on. One moment, apologies. WPR RC 73, conference paper number 1, 27th of October 2022, non-communicable disease prevention and control. The Regional Committee, recalling the Sustainable Development Goal, SDG, target to reduce premature mortality from non-communicable diseases, NCDs, by a third by 2030. The WHO Global Action Plan for the Prevention and Control of Non-Communicable Diseases 2013 to 2030 and its implementation plan, the high-level meetings of the United Nations General Assembly and its 2018 Political Declaration on NCDs, and the thematic priority on NCDs and ageing in the Western Pacific, presented in For the Future Towards the Healthiest and Safest Region. Recognizing that NCDs, including cardiovascular and chronic respiratory diseases, cancers and diabetes, are the leading causes of death and disability globally and accounted for 87% of all deaths in the Western Pacific region in 2019. Affirming that effective prevention and control of NCDs requires investment to transform social and health landscapes from a disease treatment-centered sick system into a people-centered health system, in which population health and well-being enable socio-economic development, noting that NCD prevention and control programs are especially important at the community and individual levels to address the diverse context and individual risks for these diseases. Acknowledging that addressing the mounting health, societal and economic burdens of NCDs requires a comprehensive and integrated approach that member states can tailor to their unique contexts. 1, endorses the Regional Action Framework for Non-Communicable Disease Prevention and Control in the Western Pacific. 2, urges member states to adapt the objectives and actions of the regional framework to the unique context of the countries and areas to ensure effective implementation, to foster cross-societal collaboration for NCD prevention and control at national, subnational and community levels, to prioritise resources for the prevention and control of NCDs. 3, requests the regional director to provide technical support for member states to adapt and implement the regional framework at national, subnational and community levels, to disseminate the regional framework to facilitate collaboration among stakeholders to support its implementation, to report periodically on progress in the prevention and control of NCDs in the Western Pacific region. Thank you, Chair.
Thank you. Are there any other proposed amendments? Please indicate your wish to speak by clicking the button on your microphone. I think with this one. How about this one? If there are no further comments, the draft resolution as amended is adopted. The consideration of proposed resolution, item 13, primary healthcare. The first proposed resolution, WPR RC73, conference paper number 2, is on primary healthcare. May I call on the English rapporteur to read the resolution with amendments from the draft uploaded in the web portal. Thank you.
Thank you, Mr. Chair. Now I am pleased to present the draft resolution on primary healthcare. Once again, the French rapporteur and I have already reflected any concerns commonly expressed by member states, both in the plenary session and online in the draft resolutions. Now I will read the resolution. WPR RC73, conference paper number 2, 27th of October 2022, primary healthcare. The Regional Committee, recalling commitments by the Regional Committee in 2015 to promote universal health coverage, WPR RC 66.R2, and the World Health Assembly in 2019 to promote primary healthcare, WHA 72.2, affirming that primary healthcare, PHC, provides the best approach to ensure the sustainability of health systems and is essential to make progress towards universal health coverage, the Sustainable Development Goals, and the Western Pacific's vision for health presented in the For the Future towards the healthiest and safest region. Deeply concerned that individuals and households continue to face financial hardship, with 1 in 5 people being pushed into poverty due to health expenses, and that inequitable access to care persists in the region. Recognising the need to move towards a new approach to primary health care that provides comprehensive, people-centred services with continuous engagement throughout the life course. Endorses the regional framework on the future of primary health care in the Western Pacific. 2, urges member states to use the regional framework as a guide to strengthen primary healthcare systems according to their context and capacity and tailored to their needs and priorities, to foster high-level commitment and intersectoral collaboration among government agencies and other stakeholders in support of a coordinated approach around primary healthcare at all levels, to invest adequate resources for primary healthcare reform. 3, request the regional director to provide technical support for member states to put into effect national policies and plans in line with the regional framework, to facilitate collaboration and sharing of knowledge, experiences, lessons and innovations on primary healthcare among member states, and to report periodically on progress in the implementation of the regional framework on the future of primary healthcare in the Western Pacific. Thank you, Mr. Chair.
Thank you, Rapporteur. Are there any proposed amendments to the resolution? I see no hands. If there are no further comments, the draft resolution is amended is adopted. Now let us resume with the intervention on item 10 on cervical cancer. Philippines, the floor is yours, followed by Cook Islands.
Thank you, Chair. Cervical cancer is the fourth highest cause of mortality in the Philippines, and we have been in full support of the global strategy to accelerate the elimination of cervical cancer as a public health problem, and have actively participated in the discussion around the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region. In support of its key strategies, HPV vaccination has been included among the standard of care for adolescents and adults in the recently published Omnibus Health Guidelines. The Philippines is awaiting the official strategic advisory group of experts' recommendation for the single-dose HPV vaccine regimen to facilitate the initiation of the health technology assessment review. Currently, the HPV vaccine using a two-dose schedule is implemented in over 105 provinces and cities in the Philippines and will be scaled up as the country prepares to work on market dialogues in making vaccines affordable. Communication and social mobilization initiatives are also intensified to ensure higher vaccination uptake in the wake of the challenging vaccination hesitancy in the country. The Philippines welcomes the updated guidelines on a rapid transition to HPV DNA testing. The country has engaged in optimizing the resource sharing of gene expert machines to include HPV DNA testing, increasing screening capacity through investments in infrastructure and equipment as we build the Philippines Health Laboratory Network includes cervical cancer as among the priority diseases. High cost of cancer medicines and vaccine access remain an issue for LMIC, and HPV vaccines is one of the most expensive. Western Pacific member state collaboration and WHO support are important in instituting sustainable mechanisms to promote the affordability and accessibility of HPV vaccines as well as patented cancer medicines. While the Philippine Cancer Law mandates interim programs to improve access to treatment and minimize out-of-pocket expenses, long-term sustainability is hinged on fair access to medicines and market stability. Thank you, Chair.
Thank you, Philippines. Cook Islands, the floor is yours, followed by Micronesia. Thank you.
Kia ora, Chair, and another warm Pacific greetings to each and every one of us. The Cook Islands commends the Regional Committee and supports the request to endorse the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific 2023 to 2030. At the same time, acknowledging other regional frameworks for vaccine, preventable diseases, and immunization, including reaching the unreached, NCD, mental health. These are key strategic frameworks for endorsement. Earlier this month, the Cook Islands screened close to 900 women for mammogram, and as a result, 18 of these women were identified requiring attention, and 15 were referred to New Zealand for further examination and treatment. Although this screening was not for cervical cancer, this highlights the importance of undertaking proper screening and increasing. Although this screening was not for cervical cancer, this highlights the importance of undertaking proper screening and increasing or expanding the coverage to achieve the set global targets, or better still, 100% coverage of our women population. This will give us a better baseline of the current situation and the extent of the problem, so that the appropriate response and management strategy can be immediately applied. The Cook Islands does not have the capacity to undertake cancer treatment in country due to the lack of specialists and key equipment. So our patients are referred to New Zealand. And so we acknowledge and thank New Zealand for this ongoing support. The second issue is to ensure we have the right gender of specialists undertaking the screening examination, such as pap smear or visual examinations, so that women and men feel comfortable to get tested for their safety and survival. Chair, as a small island state, the cost of acquiring vaccines such as HPV, which is vital to prevent or eliminate cervical cancer, is a challenge, and we look forward to the support from our regional and international partners. We seek support in supplying HPV vaccines in the same approach as the supply of COVID vaccines. The Cook Islands last vaccinated some of its 15-year-old girls in 2018. Again, this program was disrupted by COVID-19. We have now managed to restart our special health visits program. Therefore, we look forward to quickly restarting the HPV vaccination program. So therefore, we hope to secure vaccines to eliminate the unnecessary death to our Pacific women. We all know women are the beautiful flowers of our homes. They form and create a special bond amongst our families, our communities, our islands, and most importantly, our region. So we must continue to prevent our women and girls from these evil diseases in order to achieve the healthy and safe region for us all to live in. I thank you, Chair.
Thank you, Cook Islands. Micronesia, you have the floor, followed by Malaysia. Thank you.
Thank you, Chair. FSM believes that no woman or girl should die from cervical cancer. Effective screening for cervical cancer is available. Vaccine is available. Treatment is very effective if abnormality identified early and treatment initiated early. Planning for comprehensive prevention and control of cervical cancer will be strengthened by ensuring women and young girls themselves, as well as leaders of cultural and faith-based groups, are involved in steering development of policies and program planning. FSM agrees that school-based approaches are needed and believe that engagement with parents and caretakers, along with young girls, is important to ensure a whole-of-family approach to awareness raising. FSM recognizes that women in hard-to-reach communities or remote islands encounter far more considerable barriers to screening and treatment services. Strategies to promote equitable access to appropriate screening technologies and treatment need to be prioritized in the framework. FSM fully supports and endorses this strategic framework. Thank you.
Thank you, Micronesia. Malaysia, you have the floor, followed by Cambodia. Thank you.
Thank you, Mr. Chair. Malaysia concurs with the draft strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region 2023 to 2030, as proposed by the Regional Committee. Indeed, the accomplishment of the strategies in the framework requires investment in inaugurating coalitions among diverse stakeholders to create a political, economic, and social environment that supports a spirit of shared responsibility. The Ministry of Health Malaysia has developed an integrated and comprehensive framework embracing the triple intervention set forth by the WHO. The strategies established in this plan are aligned with the global strategy to accelerate the elimination of cervical cancer as a public health problem and are tailored to the needs and priorities of Malaysians. The National School-Based HPV Immunization Program, which commenced in 2010, targeting 13 years of old girls, has achieved more than 90% coverage. However, the COVID-19 pandemic has substantially disrupted preventive healthcare, including HPV vaccination and cervical cancer screening. Following the movement control order in the social and economic sectors in March 2020 in Malaysia, the school-based vaccination program was shifted to a clinic-based setting. This move resulted in 98% of eligible schoolgirls completing their HPV vaccination. A sharp increase in demand resulted in a post-pandemic global HPV vaccine storage. Hence, extensive endeavors are in place to secure HPV vaccines provision in phases in 2022. Catch-up vaccination will be initiated for the older affected schoolgirls to ensure sufficient coverage, whereby the school-based HPV vaccination is projected to recover by 2025. Malaysia wishes to raise our concern about the high cost of HPV vaccination and supply of this vaccine. We call for HPV vaccination to be affordable and accessible to all in the spirit of leaving no one behind. As for cervical cancer screening, our latest initiative since 2019 involves integrating in phases the high-performance HPV self-sampling test into the screening program for women aged 30 to 65 years and tested at a 5-year interval for HPV-negative women, ensuring a test, triage, and treat model following WHO's recommendation. Currently, this HPV testing has been implemented in 12 out of 15 states and is expected to reach nationwide in 2023. As the COVID-19 pandemic has taken a substantial toll on the healthcare system, a fundamental shift in service delivery is imperative to attain successful consolidated services focusing on people's and communities' needs, safeguarding sustainable vaccination, screening and treatment programs through efficient coordination, sufficient allocation of resources, and ongoing data monitoring is fundamental to achieving the elimination targets. Community engagement and empowerment of the people remain at the center of all efforts, as women must be fully involved and welcomed as partners to implement the elimination strategies. Thank you, Chair.
Thank you, Malaysia. Cambodia, you have the floor, followed by USA. Thank you.
Thank you, Chair. In Cambodia, cervical cancer is the most common cancer in women. As of December 2021, a total number of 5 national hospitals and 79 referral hospitals and 271 health centers have provided cervical cancer screening and treatment. A total number of 178 general physicians and 696 midwives has been trained and gained on knowledge and skill of cervical cancer screening and management. Cambodia developed and implement the new National Action Plan for cervical cancer prevention and control in line with the strategic framework of comprehensive prevention and control of cervical cancer in the Western Pacific Regional 2023-2030. Cambodia strengthened health service, especially at primary health care level, to expand cervical cancer screening and treatment service and provide HPV vaccine to
to the girl through integrate HPV vaccine into the national immunization program through implementation of the National Strategic Plan for Prevention and Control of NCD 2022 and to 2030. Thank you, Chair.
Thank you, Cambodia. United States of America, you have the floor, followed by Solomon Islands.
Thank you, Honorable Chair. The United States strongly supports the goal of eliminating cervical cancer, one of the most common cancers occurring in women, which is also one of the most preventable and treatable malignant diseases. We appreciate the strategy's emphasis on prevention as part of the approach to reach the elimination goal, and the critical need to scale up accessible sexual and reproductive health services, including vaccination, screening, detection, early diagnosis, treatment, and care for women, which will prevent and reduce suffering, improve outcomes, and advance cervical cancer elimination. The United States recognizes the critical importance of integrated sexual and reproductive health services in screening, detection, and early diagnosis for cervical cancer, and in the particular burden impacting women living with HIV. We urge WIPRO, member states, and stakeholders to support continued scale-up of HPV vaccination, including in partnership with Gavi, continued scale-up of screening and treatment services, data system strengthening, as well as cooperative research that will promote cervical cancer control and elimination faster and at lower cost, including expanding vaccination access to boys. Thank you, Mr. Chair.
Thank you, United States of America. Solomon Island, you have the floor, followed by Tuvalu.
Thank you, Honorable Chair. For Solomon Islands, the interventions outlined in the strategic framework were initially piloted in 2015 to 2016. In fact, cervical cancer is ranked second as the leading cause of death for women in the country. Hence, piloting of cervical cancer prevention activities with the support from Family Planning Australia in New South Wales, who assisted in training of health workers for cervical cancer screening, was seen as an important step towards prevention and control of cervical cancer. Furthermore, 2-dose HPV vaccination was rolled out to girls of age between 9 to 14 years during the same period. This has become part of the country's routine immunization schedule under the National Expanded Program for Immunization. It is planned to roll out the single-dose vaccination soon after technical planning and operational arrangements were outlined and shared for approval by the Ministry of Health and Medical Services. With the current interventions being implemented and being a relatively new program, there are challenges ranging from lack of provision of screening services for women in the country, availability of treatment, lack of detailed and resource action plans, lack of comprehensive advocacy and communication materials for women and girls. And so there is the urgent need for further upskilling of healthcare providers and institutionalizing cervical cancer activities into all levels of the healthcare system. Our view is that the strategic framework will offer broad guidelines for the development and strengthening of the National Cervical Cancer Control Program, ensuring sustainability towards achieving global targets for elimination of cervical cancer. But most notably, gives the opportunity for the country to develop policies and strategies that are contextualized to the country's need to address cervical cancer. We therefore welcome and endorse strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region, 2023 to 2030, and look forward to WHO in supporting countries in further developing their cervical cancer prevention and control program. I thank you, Chair.
Thank you, Solomon Islands. Tuvalu, you have the floor, followed by the U.S. territories. Thank you.
Honorable Chair, distinguished delegates, ladies and gentlemen, cervical cancer is one of the areas of concern and interesting to Tuvalu,
as it does impact the livelihood and well-being of our people, in particular, women and girls. Our records are showing that there were 6 deaths due to cervical cancer from 2007 to 2016. This is a high number compared to our total population, where the median age of death was 49 years of age. The patient was given support from local agencies and technical support from UNICEF, with financial support through a project was funded by the Asian Development Bank, ADB. We have also commenced the system strengthening for effective coverage of the new vaccines in Tuvalu, a project through which our immunization system is being strengthened. Despite the pandemic challenges, Tuvalu has introduced all 3 new vaccines, which included papillomavirus vaccine, pneumococcal conjugate vaccine, PCV, and rotavirus vaccine in our national immunization schedule during 2021 under the project of simultaneously incorporating strategies aiming towards the elimination of cervical cancer. In the meantime, we have covered 81% of our 10-year-old girls through routine immunization and are midway in catching up 11 to 15 years old girls through campaign with focus on equity. In addition, Tuvalu has decided to adopt single HPV schedule based on the recent WHO recommendation. In partnering and collaborating with existing non-governmental organizations, the Ministry of Health had also started another cervical cancer screening with the age between 25 to 55 years of age women in all areas of Tuvalu to identify the pre-cancer cases early and manage them in Tuvalu. For the first time, the processing of the samples is done in Tuvalu. If there are any cases diagnosed with cancer, they will be referable for proper and medical management. To conclude, Tuvalu is committed and support the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region 2023 to 2030 in protecting our girls and women. I thank you, Mr. Chair.
Thank you, Tuvalu. The U.S. territories, you have the floor, followed by Brunei.
Thank you, Mr. Chair. The United States territories cannot emphasize enough the need to eliminate cervical cancer, especially since it's very treatable and preventable. Therefore, we support the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region. The focus is on health system development and access to care with sustainable approaches tailored to the country or territory and aligned with global targets. The approach to managing cervical cancer in a similar manner to the managing of COVID-19 in the Western Pacific region is a necessary initiative. As in COVID-19, detection, prevention, and vaccination and treatment are key factors in this management. Racial and cultural approaches are critical for detection. In the U.S. territories, the number of women who have yet to be screened is significant. Providing support for outreach is essential, and we do have an opportunity to expand capacity further with assistance to access molecular testing in the territories. Also, cancer management requires a strong health system and workforce. Unfortunately, the territories of American Samoa and the Commonwealth of the Northern Mariana Islands are still a single hospital system, and workforce issues are a constant problem for all 3 territories. Like other Pacific countries and territories, we're still sending our women thousands of miles away from their families to receive treatment, separating them from their families and weakening their treatment outcomes. The United States territories strongly support the strategic actions listed in the Strategic Regional Framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region, especially highlighting that evidence-based messaging, HPV vaccination, adequate resourcing, optimal prevention, screening and treatment, and that doing nothing or not doing enough is no longer acceptable. Thank you.
Thank you, U.S. territories. Brunei, you have the floor.
Thank you, Chair. Despite the challenges brought by COVID-19 pandemic, Brunei Darussalam remains resolute in our commitment to the implementation of resolution on the global strategy to accelerate the elimination of cervical cancer as a public health problem and its associated goals and targets for the period of 2020 to 2030. Since the launch of the National Cervical Cancer Prevention and Control Program in 2009, We have established a pap test registry, a call and recall system for cervical screening, replaced the conventional pap test to liquid-based cytology system, implemented school-based HPV vaccination program, and produced a national guideline on cervical screening and management, thus ensuring standardization of patient care and management. In 2020, Brunei Darussalam achieved a cervical screening coverage rate of almost 50%. Correspondingly, the age standardized incidence rate of cervical cancer in Brunei Darussalam declined from 20 per 100,000 in 2012 to 12 per 100,000 in 2021. Cervical cancer has now dropped from being the second most commonly diagnosed female cancer in 2009 to being the fifth most commonly diagnosed female cancer in 2021. From 2015 to 2020, HPV vaccination coverage rate for female adolescents remains consistently high at 93 to 94%. In 2021, however, the pandemic disrupted the vaccination program, resulting in decline in the coverage rate to 91%. However, catch-up vaccination programs are now undertaken to improve our coverage rate to pre-COVID levels by running a massive catch-up programs, including offering vaccines by list of schools in the various COVID vaccination centers. Brunei Darussalam's commitment to combating cancers is evident in the provision of free high-quality service for the management of pre-cancer and invasive cancers. This includes the setting up of National Cancer Center that provides high-quality cancer treatment. In the early 2021, the Ministry of Health has launched brachytherapy service, which will have a positive impact on cancer management in reducing mortality and morbidity. Our next step is to introduce HPV test as our primary screening test for cervical cancer. The HPV self-sampling is another strategy being considered to further increase our screening coverage rate. One local study involving cervical screening non-attendees found that HPV self-sampling was positively received by more than 90% of the participants. Finally, Brunei Darussalam is fully committed to the elimination of cervical cancer as a public health problem by scaling up national HPV vaccination program, cervical cancer screening program, and providing universal health coverage for all. Thank you very much, Chair.
Thank you, Brunei. Are there any more interventions on this topic? If not, I understand that the following non-state actors have submitted a video statement to the committee on this agenda item. International Association for Hospital and Palliative Care and Daffodil Center. Secretariat, please play the video.
I am Dr. Rumali Corvera, founding president of the Ruth Foundation for Palliative and Hospice Care, founding board member and past president of the Philippine Society of Hospice and Palliative Medicine, and delegate for the International Association for Hospice and Palliative Care, a non-state actor in this Western Pacific regional meeting. Palliative care is now part of the Philippine healthcare strategies in both the Universal Healthcare Law and National Integrated Cancer Control Act. It is time to push for their implementation through capacity building, better access to medications for pain and other distressing symptoms, programs and community services to address psychosocial and spiritual despair, and health packages that cover the palliative care needs of all cancer patients, cervical cancer in particular. As a new palliative specialist back then, doing home visits for underprivileged patients, the women facing incurable cervical cancer left me with very vivid imprints of suffering. One such patient I attended was writhing in pain with each urge to urinate and agonizing over her constant foul discharge, the fear of cervical bleeding, and fecal contamination in her urine, all unrelenting sources of incontinence, infection, and worse yet, loss of dignity, loss of hope, loss of person. This is just one woman among hundreds of thousands others facing advanced cervical cancer, one in countless millions still suffering needlessly. I support the IAHPC recommendations to improve availability and access of palliative care services for cervical cancer patients. We appeal to the WPR member states to adopt the essential package of palliative care for cervical cancer, to use the International Narcotics Control Board Learning Project to introduce palliative care into the undergrad curricula of medical professionals, and to partner with regional palliative care alliances such as the Asia Pacific Hospice and Palliative Care Network.
It was a privilege to have a role in supporting the WHO strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region from 2023 to 2030. The framework is your resource, and it's based on evidence, perspective, and recommendations for action communicated to us through extensive consultation with member states. Your advice was both focused and comprehensive. Among the wide-ranging input from member states, which comprises the framework, 4 key themes are consistent throughout. Firstly, there's a high level of engagement and commitment to the WHO Global Elimination Strategy among key stakeholders and member states. Secondly, diversity among member states will require a tailored and localized solution to implement the WHO Global Elimination Strategy. Thirdly, meeting the targets of 90% vaccine coverage, 70% screening, and 90% treatment access will take many years in a number of countries. Therefore, evidence-based incremental approaches will be essential to building capacity over time, tailored according to what's feasible and delivers optimal short and long-term outcomes. And finally, effective advocacy will be key to action and outcomes led by multiple sectors and adapted according to the specific needs and settings in various member states. The framework sets out tangible steps as recommended by you and your representatives under the headings of strategic actions to meet the WHO vaccination targets and interim actions to build screening capacity incrementally. We look forward to ongoing opportunities to work with member states and the WHO Western Pacific Regional Office to maintain the momentum and work towards the goals of the WHO Cervical Cancer Global Elimination Strategy. Thank you.
Thank you very much. All written and video statements from non-state actors and observers on this agenda item will be uploaded to the RCM webpage. As statements reflect solely the views of the NGOs concerned, it follows that statement do not necessarily reflect the views of WHO, including its member states and Secretariat. May I now call on the Secretariat to respond to the points that have been made. Thank you.
Thank you very much, Mr. Chair. First of all, we'd like to thank member states for your excellent interventions and your strong support to the strategic framework for the comprehensive prevention and control of cervical cancer in the Western Pacific region. On behalf of the WHO Secretariat, I also like to take this opportunity to sincerely thank all member states for your contribution to the development of the draft framework during the member state consultation and several rounds of reviewing the draft strategic framework and providing valuable insight and suggestions toward improvements. Acknowledgement also goes to our key partners, experts, and WHO collaborating centers for their immense contribution to the framework. There was a lot of valuable comments and recommendations received today. I would like to highlight the following points. First, member states saw concern regarding the high burden of cervical cancer in their country and highlighted the urgency of action that needed to accelerate effort toward achieving elimination of cervical cancer as a public health problem in our region. We need strong political will, effective governance, and prevention strategies that integrate existing service delivery platforms to effectively combat growing threat of cervical cancer. Many countries highlighted the need to strengthen community engagement for the success of the prevention and control of cervical cancer. It is essential that countries must engage sector beyond health and adopt comprehensive approach to empower the whole of society and communities. In the context of preventing cervical cancer, member states also highlighted the challenges in implementing the intervention to increase uptake for HPV vaccines and cervical screening. Since HPV vaccination is an essential component of cervical cancer control for future generations, countries should consider including vaccination of HPV into the national immunization program as being planned by member states, including Kiribati, Mongolia, Solomon Islands, and Vietnam. We congratulate Brunei Darussalam for achieving more than 90% of HPV vaccination coverage, even during the pandemic time. Member states, including New Caledonia, Federal States of Micronesia, and Samoa, highlighted the importance of school-based approaches and engaging parents and carers to ensure high HPV coverage and the whole family approach to increase awareness in the community. The WHO Regional Framework for Vaccine Preventable Diseases and Immunization in the Western Pacific, endorsed by the Regional Committee in 2020, pave a platform and complement to the cervical cancer strategic framework with the goal of achieving at least 90% of HPV vaccination for the girl age of 18. The issues of cost and access to vaccine has been raised by a number of countries. The recent endorsement of strategic advisory groups of experts on immunization on a single dose of HPV vaccine can help to accelerate the uptake of HPV vaccine and reduce operational costs for member states in deploying this vaccine, as mentioned by the Philippines. Screening coverage must be increased, and Kiribati and Vanuatu have shown good examples of working with local NGOs to reach out to communities for screening. The Republic of Korea, Mongolia, and New Zealand have a so strong commitment, including cervical cancer screening as a part of national programs. We also support the suggestion from US, New Zealand, Australia on the importance of integration of cervical cancer screening with sexual reproductive health and HIV/AIDS program. Member states also highlighted that capacity building toward effective treatment of cervical cancer is essential for cervical cancer management. While capacity building needs long-term planning and resources, foreign countries are encouraged to strengthen partnership with countries which already have a well-developed program. We are very proud to have Australia, which is on track to be the first country in the world to eliminate cervical cancer. WHO is ready to facilitate this partnership and collaboration. WHO will continue to support member states in the development of National Cancer Action Plan and culturally sensitive communication and advocacy tools to increase the uptake of vaccination and screening. A platform for sharing best practice and innovative approaches can be created so that member states can learn from each other, such as the digital health platform for screening being used in Malaysia. As requested by many member states, WHO will also facilitate in identifying the sustainable mechanism to improve access to vaccine and test supplies in collaboration with other key partners. WHO also continue to provide the technical support for the development of treatment protocols, cancer registry, and financing mechanism. WHO will also develop guidelines on monitoring the 90-80-90 targets as suggested by Japan. Again, thank you very much, member states, for your intervention, your ongoing work, and strong endorsements of the framework so that we can eliminate cervical cancer in the Western Pacific. I'm now handing back to you, Mr. Chair.
Thank you, Dr. Hong. If there are no further comments, may I request the rapporteurs to draft an appropriate resolution. That concludes our consideration of this agenda item. Thank you very much. Ministers, Excellencies, ladies and gentlemen, you have done very well with time and speed. So we will move on to the next item. Item 11, mental health. Document WBR RC73/7. And may I invite Dr. Capuano, DBM, to introduce this item. Thank you.
Thank you, Mr. Chair, distinguished representatives. I am pleased to present for your consideration document WPR/RC73/7 on mental health. Good mental health is essential to the health and well-being of everyone, everywhere. It is also critical to a well-functioning society, as well as fostering social capital and solidarity that are essential during times of crisis. However, the region is facing a looming mental health crisis driven by social pressures such as rapid urbanization, the digitalization of lifestyle, and other vulnerabilities. More than 215 million people in the Western Pacific are living with a mental health condition, and suicide among young people is particularly concerning. The burden of poor mental health is felt across the entire life course and disproportionately affects vulnerable populations. Poor mental health also has a significant cost to the economy due to loss of productivity and increased healthcare expenditures. Indeed, the impact and implications of the chronic under-prioritization of mental health is wide-reaching. The problem has only grown worse during the COVID-19 pandemic. In 2014, the Regional Committee endorsed a regional agenda for implementing the Mental Health Action Plan in the Western Pacific. Since its endorsement, the region has made some progress in advancing this agenda. All 29 countries and areas that responded to the latest Mental Health Atlas survey have a standalone or integrated mental health policy or plan, and there has been an increase in mental health promotion and prevention programs and activities. Despite these advances, much remains to be done in order to address the urgent needs of the present and anticipate future challenges to mental health in the region. Mental health remains stigmatized, and the transition towards community-based care and support has been slow. Mental health systems are unable to fully address the needs of people living with a mental health condition, much less the needs of the entire population. In 2020, in close collaboration with member states, the Secretariat began to develop a new regional framework for the future of mental health in the Western Pacific 2023-2030. The outcome of this nearly 3-year journey is a draft framework presented for your consideration. Co-created with member states and other key stakeholders, the vision behind the regional framework is nothing less than the highest level of mental health and well-being for all people in the Western Pacific, an approach grounded in social solidarity for a transformative environment that promotes mental health for all. The regional framework provides guidance for member states to refocus the mental health agenda to include well-being, enriching the enriched, the transformation of mental health support and care into a community-based ecosystem of health and social services and innovations, and the embedding of mental health into the settings, journeys, and practices of daily life in communities. The Regional Committee is invited to consider for endorsement the draft regional framework for the future of mental health in the Western Pacific 2023-2030. The Secretariat would like to show a short video on this agenda item. Thank you, Mr. Chair.
The Western Pacific region is facing a looming mental health crisis. Over 215 million people in the region suffer from a mental health condition. Many more are feeling worried, distressed, and hopeless because of COVID-19 pandemic. Current approaches to mental health are leaving too many behind. For the future of mental health, social services and support must be provided beyond the health sector. The regional framework for the future of mental health in the Western Pacific aims to transform the environment for mental health and well-being in the region. Mental health for the future must refocus the mental health agenda to include well-being and reaching the unreached, transform mental health care and support into a community-based ecosystem of health and social services, embed mental health into communities and everyday life. There is no health without mental health. The time is now for social solidarity behind mental health and well-being for all.
Thank you, Dr. Capuano. We will now hear from representatives who wish to speak on this item, please indicate your wish to speak by clicking the button on your microphone if you are in the plenary, or by using the raise hand function on Zoom. Please speak slowly and directly into the microphone for our interpreters. Thank you. Philippines, you have the floor, followed by Tonga. Thank you.
Thank you, Chair. The Philippines fully supports the regional framework for the future of mental health in the Western Pacific, which highlights the need to reorient the current mental health paradigm from a disease-oriented focus towards putting well-being of people and communities at the center. Such a shift was already articulated in the country's mental health law, which was passed in 2018, and the National Mental Health Strategic Plan, which was operationalized in 2019. The regional framework aligns with our strategic commitments, such as improving knowledge, attitudes, and practice of individuals, including the stigmatization by first, mainstreaming mental health interventions in schools, communities, and workplaces. Second, by issuing guidelines and capacitating media practitioners. Third, by promoting the rights of service users. Fourth, by improving access and delivery of services through robust capacity building of primary care providers. Fifth, by providing medicines through the Medicines Access Program for mental health. And sixth, by making available local crisis hotlines in every region in the country. Despite existing multi-sectoral platforms successfully translating evidence to action and scaling up local innovation remains a big challenge. We would appreciate mechanisms to learn from different member states, innovative ways to strengthen sectoral and local leadership and ownership, as well as rapidly multiply capacity for service provision to respond to the demands. Consistent with the global directions promoting the institutionalization and shifting to community-based management, additional guidance is also necessary for improving non-specialized healthcare provider capacity for case review and intervention for unseen cases. Lastly, in order to further empower individuals and families, we also request the WHO to provide further evidence-based guidance across different life stages, including risk-based approaches to using unguided and guided digital mental health technologies. Thank you, Chair.
Thank you, Philippines. Tonga, you have the floor, followed by Cook Islands. Thank you.
Thank you. Thank you, Chairman. Tonga endorses the regional framework for the future of mental health in the Western Pacific 2023-2030. COVID-19 has hit us all, and all of us are experiencing stress and distress from the new norm the COVID has brought in, and Tonga is not an exception. Some families were not able to unite for a long time because of the tight border control. Also, we had the Hunga-Hapai volcanic eruption and tsunami, which also added more stress and anxiety to people, especially those who were affected by the tsunami. It brought us solidarity as Tongans. We stood together to prepare and respond to COVID and to recover from the impacts of the volcano and tsunami. But it also brought us division with the border closure, lockdowns, decrease in social events and mass gatherings, and social distancing, which are an important part of our culture. This increased people's stress and anxiety, which will affect our well-being and productivity. We welcome the new direction the new regional framework is taking to move away from traditional approach, focusing on people with mental disorders, and refocusing to include well-being for all. It is particularly important to embed mental health into various settings to enhance protective factors and reduce risk factors across the life course. In Tonga, through Health Promoting School program, we have been introducing mental health and well-being as one of the pillar intervention for primary and secondary schools. We must promote and protect mental health to improve health and well-being of the population. And this framework shows us the direction we need to take. Tonga is committed to strengthen mental health services and mental health promotion in our country by implementing this new regional framework. However, any instrument needs adaptation to the country and cultural context. So Tonga would like to request for further guidance on how we can effectively implement this regional framework in the Pacific context. So we look forward for the guidance and support from WHO and other partners. Thank you, Honorable Chair.
Thank you, Tonga. Cook Islands, you have the floor, followed by Lao PDR.
Thank you, Chair. The Cook Islands commends the Regional Committee and support the endorsement of the draft regional framework for the future and mental health in the Western Pacific 2023 to 2030. COVID-19 have accelerated the increase in the number of mental health cases, affecting our people from stress due to reduced income to families, living on subsidized income from government, and the inability to be referred overseas for specialist medical treatments, just to name a few. And for frontline workers who work tirelessly for long hours during the peak of our COVID response. Social problems amongst young people continued, resulting to suicide or violent behaviors also continues to increase. And most recently, with the introduction of vaping, it is now becoming a problem to our very young children. I am grateful to hear some member states taking strong stance in the ban of e-cigarettes. For many years, people with violent mental health conditions are placed in our prison, where medical officers will attend to them in prison. And I am happy to confirm that for the first time, the Cook Islands will be having its first mental health facility scheduled to be open next month. In our government budget for this fiscal year, the budget has been allocated for the recruitment of a law and order clinical psychologist. We also welcome the current mental health research projects in the Cook Islands, which are expected to be reported to the health conference scheduled for the month of September 2023. Therefore, the Cook Islands welcomes the development of this regional framework, and we do recognize the investment in workforce, resources, and training will be required to ensure that quality care is available to our people with mental health needs. The cost of responding to mental health matters in the outer islands, especially to the far northern part of the Cook Islands, continues to be a challenge. So therefore, we seek the support of WHO and our regional and international partners for training opportunities for our nurses and doctors who will be working to staff the new mental health facility due to open soon. The Cook Islands would like to acknowledge the great work of the people who were involved in the development of this regional framework. Thank you, Chair.
Thank you, Cook Islands. Now, PDR, the floor is yours, followed by Vietnam.
Thank you, Chair. For the Lao People Democratic Republic, mental health and well-being is identified as a priority for overall development in the 9th National Socio-Economic Development Plan from 2021 to 2025. Mental health is fundamental to enable individuals and communities to achieve the full potential and improve overall health and well-being. Having faced COVID-19, a string of disasters, and now economic challenges, we are reminded for this importance of mental health and have a newly reinforced commitment to addressing it. We believe mental health and psychological support require multi-sectoral collaborations and community engagements. Therefore, we are seeking to improve national and sub-national capacities to improve mental health and psychological support. In close collaboration with other sectors like education, labor, youth and women's unions, as well as social welfare, as well as empower communities. For this, with the support from WHOs and rounds of consultations, we adopted the WHO Mental Health Gap Action Programs into 3 mental health and psychological support guidelines that fit the Lao context. These are now fit for purpose and provide an effective tools. Furthermore, using the guidelines, we have conducted trainings for healthcare workers, mass organization, and all the sectors in the capitals and selected province. But this is only the first stage. Now we are finalizing plan to train more healthcare workers from central to community levels in providing mental health and psychological support. We are focusing strongly on primary healthcare as a tool to deliver these services to improve equitable access to mental health and psychological support, and to increase awareness to help overcome stigma and discriminations. We look forward to continue collaboration and support from WHOs on mental health and psychological support through strengthening primary healthcare in order to achieve USC in Lao PDR. Finally, we support the endorsement of the draft regional framework for the futures of mental health in this region. I do thank you.
Thank you, Lao PDR. Vietnam, you have the floor.
Thank you, Chair. Vietnam is facing a burden of mental disorders. Survey data estimated that the prevalence of the 10 most common mental disorders in Vietnam is about 14% of the population. Moreover, COVID-19 pandemic had a critical impact to worsen the situation with the increasing of suicides, depression, and other mental disorders among population. Responding to the situation, Vietnam is in the process of development of the National Master Plan on Mental Health Care 2022-2030. Vietnam considered that the framework for the future of mental health in the Western Pacific will play an important guidance for member states to develop and implement mental health plans at country level. Vietnam endorsed and recommends the endorsement of the regional framework for the future of mental health in the Western Pacific 2023-2030. Thank you, Chair.
Thank you, Vietnam. Ministers, Excellencies, ladies and gentlemen, we will now break for lunch. There will be a side event on Passage to Innovation at 12:45 here in the plenary room. See you back here at 12:45 for the side event, and at 2 o'clock p.m. we will start item 16.5 on intergovernmental negotiating body. We will resume intervention on mental health after item 16.5. Thank you.
water pumps that don't need power, for sanitation no matter where you live, a custom fitted lorry, providing eye care to the underprivileged, a health hotline system reveals potential epidemics, a smartphone application detects antimicrobial resistance. The biggest dream, the smallest shift, they ripple out and lift us up. The world is changing, we must create a healthy future. We gotta innovate, predicting risk for heart disease, using algorithmic technology, social network messaging, promoting services for HIV, supporting work for older people, for independence and a more active life, games to change behavior, better eating habits, healthier diet. The biggest dream, the smallest shift, they ripple out and lift us up. The world is changing, we must create a healthy future. We are here to help you find, adapt and scale and redesign. The future's now, let's accelerate to a healthy world, because we innovate.
Oh, I have to wait. Oh, my lack of patience is showing. Right, now it's working. I shall start again. Good afternoon, honourable ministers, delegates, colleagues. Apologies for starting a few minutes late. We were hoping that we'd be able to get some more people into the room, but I see we have a full complement online. So also welcome to our online audience as well. So this is in fact the third innovation side event at the RCM, but it's the first in person. My name's Amy Cawthorne, and I'm the coordinator for strategic dialogue and innovation at the regional office, and I am your human moderator for today. Now, some of you may remember a person who will be joining us online from last year's RCM, and that's Agatha, who's my virtual colleague and virtual co-moderator. Agatha, would you like to say hello?
Good morning, afternoon from Malaysia. It's nice to see you again. I'm currently in Malaysia to connect with older people here to see if I can be of any assistance in communicating healthy aging messages. I look forward to traveling to more member states to co-design with older people. Feel free to reach out to me if you're interested in creating a healthy aging society where older people can continue to stay healthy, active, and contribute to society.
Thank you very much, Agatha, and it's lovely to see you again. Just a quick reminder on timekeeping for all our speakers. We need to be a bit mindful of the time because we have the plenary session, which will be starting in about an hour's time. Because of a slight change in the agenda, each speaker has slightly longer than was planned, so it's between 5 and 7 minutes per presentation. But first of all, allow me to first invite Dr. Corinne Capuano for an opening remark. Corinne, the floor's yours.
Thanks, Amy. Good afternoon and welcome to the side event, Passage to Innovation. I would like to thank everyone, both here in person and online, for being with us today. The name of this event is inspired by the 1870s Walt Whitman poem, Passage to India. The poem celebrates some of the marvels of the day, including the Suez Canal and the transatlantic cable that allowed men and women to know one another in a new way. Now, 152 years later, we take the passage to innovation from the world we live in and head into the future we need. COVID-19 has threatened our health, severely challenged economies, deepened poverty and inequalities, and revealed our interconnected vulnerability. The disastrous effects of conflict and a changing climate are threatening our very existence. Let there be no illusion. Challenges we see today may be tiny in comparison to the future. We are at a point of inflection. The choice before us is to continue with business as usual and risk breakdown, or to make efforts to break through. Governments have an unprecedented moment to reaffirm to people that health is the foundation of growth. This is our mission. It is high time for countries to devise strategies for breaking through. The Regions for the Future vision makes innovation an operational shift and mandates the quest for novel processes, policies, products, programs, and systems to improve population health. Innovation is not owned by the private sector, but rather an integral part of health ministers' future roles. As suggested by the WHO Council on the Economics of Health for All, governments should fulfill their innovation role through shaping values, setting goals, leading directions, catalyzing and scaling up solutions to address complex challenges. This side event is a showcase of health innovation in member states in our region. It is also a deliberation of next steps to achieve our innovation mission. It invites health ministries to make commitments to invest in health innovation. WHO will support countries to chart the path and formulate a strong and inclusive regional innovation network to catalyze transformation. Thanks, Amy. Back to you.
Thanks, Corinne. And with your invitation to imagine a future and to motivate and encourage countries across the region, we would like to start today's journey with all of you listening online and in the room by taking a look back down the memory lane of innovation in Wipro and the region. Some of you may remember that at the beginning of 2020, WHO in the Western Pacific region embarked on a journey to identify and amplify innovation. So let's take a short video tour of the progress and milestones so far.
The WHO Western Pacific Region's For the Future vision demands answers to pressing questions. What can we do to bring safe water to remote and rural populations? How can we overcome misinformation and increase vaccination rates? How can governments keep older people healthy, productive, and socially connected? Questions such as these demand innovation. 3 years ago, the region embarked on a journey seeking innovations that could scale to whole populations. Our first innovation forum in 2020 forged a vision of a healthy future. Our second in 2022 explored how member states could foster, govern, build, and regulate innovations. This year, the Innovation Challenge surfaced over 100 solutions, with 29 organizations and individuals announced as winners. Need a water supply in remote areas? Here is a ram pump that uses the energy generated by falling water. Want to overcome vaccine misinformation? Here is an AI chatbot that circulates verified information on COVID-19. Curious how to foster participation among older people? Here is a career consulting service for people aged over 50, helping them to find jobs even beyond retirement. Such innovations call on governments to strengthen the public sector's ability to innovate for the public good. To support innovation, WHO curates an online database of member state innovations, the Western Pacific Innovation Repository. We run webinars on community innovations, and issue weekly roundups of solutions that promote both health and growth. We share the work of member states in aligning innovation with public health needs through conducting literature reviews and country case studies, such as this one on how Malaysia delivers cataract extraction at scale. And now we propose to embark on another milestone in our innovation journey. We invite member states to join us in crafting a regional strategy to accelerate health innovation in the Western Pacific.
So in the video, one of the things that was introduced was the Innovation Challenge. And this is a really fabulous example that showcases the amazing potential for innovation in this region. It also highlighted how we get there through partnership. So following the conclusion of the Innovation Challenge, the Lancet Regional Health curated a special edition of Health Innovations with us. Dr. Chai, the Editor-in-Chief of the Lancet Regional Health Western Pacific, is kindly joining us from Beijing to deliver us a virtual message. Dr. Chai, over to you. Dr. Tsai, are you with us? Colleagues online and in the room, just give us a couple of minutes. Even with our extensive virtual experience over the last few years, we can still have a few little technical issues. So in order to keep time, what we're going to do is we're going to come back to Dr. Tsai in Beijing to hear more about the challenge publications. But what we'll do is we'll move on to our country panel, which is all about sharing examples from around the region. So our next journey takes us to 3 countries in the region: Malaysia, Cambodia, and Singapore. And these stories that we're going to hear highlight the role innovation is playing in showing us new ways of delivering services closer to the community, in developing strategies that harness the power of innovation to shape the future of health, and the development of innovation ecosystems. Our first stop is Malaysia, and Director General of the Ministry of Health, Tan Sri Dr. Noor Hisham Abdullah, is with us today. And he's going to share with us an innovation in eye care service delivery at the community level. Dr. Hisham, the floor is yours.
Thank you, Chair. Ladies and gentlemen, good afternoon. First and foremost, I would like to thank the organizing committee for the opportunity to be here to share our health innovation to address the accessibility, affordability, and equity of unmet needs of cataract surgery in our community. We mooted these innovative ideas more than 10 years ago. That is to bring surgery nearer to the patients and to reach out to the unreached population. We all know in most instances, cataract surgery has been done under local anesthesia. Therefore, it can be considered to be done nearer to our patients and community. More importantly, this innovation allows and free the general operating theaters in the tertiary and state hospitals for non-cataract and more complex cases to be done under general anesthesia. The health innovation indirectly reduce the traveling time, logistic costs of the patients as well as for the government. It reduced the waiting time and cancellation of surgery. It increased the efficiency of surgery and improved the quality and safety. It optimizes the usage of facilities and allow more access to opportunistic screening in the population. May I have my slides, please? So next slide. So these are the justification of this service model. It's not only for cataract, but it's applicable to all forms of surgery. In fact, surgery is a neglected component of the primary care. And this is important model to solve some of the problems in the rural areas in terms of accessibility, affordability, and equity. Next. Now, our concept is a patient-centered healthcare model whereby we focus on the patient and the community. And this idea or innovation is cost saving for the patient in terms of traveling costs, as well as when you look into the logistic costs for the patient and the family to accompany the patients to the state or district hospital. And it's also cost saving for the government from high volume with good outcome. This is something that we would like to expand. And more importantly, it fosters opportunities and also partnership between the public and private, and also gather the sectors, private sector and public sector coming together as one to address some of the pertinent health issues in the rural areas. Next slide. Now, this is the framework of cataract outreach services in the Ministry of Health. So we have a hospital, mainly tertiary or state hospital, and we have a Ministry of Health cataract outreach program. Now, in the hospital lately, the post-pandemic have left us with 60,000 of backlog cases, and 30% of the cases are cataract operations. And here, to solve some of the problems that we had, so we did a mass cataract surgery initiative in respective hospital in North Borneo, in Sarawak, in other districts, hospitals. And this is where coming together as one, public sector, private sector, the whole government and whole society approach, we managed to reduce the cost and comes to a district and clear all the cataract operations during a period of time, less than a week. So this is an initiative that we have done. Within 6 months, we have managed to bring down the backlog cases to less than 10%. So this is something that we can emulate, not only for cataract, for other surgery as well. We have done it for cleft lip, we have done it for renal stones, PCNL procedures, and etc. Now, when we look into a cataract clinic in the Ministry of Health, we have a mobile clinic. That is to a mobile cataract clinic in Sarawak, in Borneo, as well as east coast of Malaysia. These services has been there even before the pandemic. And we came up with this idea of taking the surgery out of the hospital, whereby Selayang Cataract Center, it is a shop lot. Next to the shop lot is a coffee shop and a car yard. But we have 2 operating theaters, and then the first floor, the ground floor, 2 operating theaters, first floor, the clinic, second floor, recovery area, and the third floor, basically administration. The buildings belongs to another organization, not Ministry of Health, but the partnership comes in. So they provide the space, we provide the services, and this is a good partnership. And the lenses come from public donations, for example, from banks and etc. They donated the lens. The cost of surgery is only 103 ringgit, basically probably about $25 for the surgery. And we also have a district hospital like Jitra Hospital, underused. BOR is very low, so we have converted the hospital to a cataract surgery hospital. And this has actually increased the outcome and impact, and with minimal cost involvement. Next. So here you can't see this vehicle, the photos. So we started mobile cataract services following WHA 66.4 resolution towards Universal Eye Health, a Global Action Plan 2014 to 2019. So we launched these services on the 12th of September 2013, and it's still ongoing. So this bus will bring all the equipments to our district hospital, and the bus with the equipments will be parked in the district hospital for 2 weeks, and then we clear all the cases in that district. We do not do the operation in the bus, but we use the minor operating theaters in the respective district. But what's more important is bringing the services to the district. And the Selayang Cataract Center, we initiated this about 10 years ago, and operational services started in December 2012, and the first surgery was done on the 16th of January. So far, we have done more than 25,000 cases for the last 10 years. Next.
Unfortunately, the slides are not available. I mean, the photos are not available. So these services, if you look into Selayang, so what we did is a community-based, one-stop, less congestion, and then we free the operating rooms in a general hospital so they can do a more complex surgery in a general hospital. So we are a one-stop center, pre-op, operation, post-op. We are looking into mainly low-risk operations. Only one surgery, that is only cataract, 2 operating theaters there, full day services from Monday to Friday. The surgeons rotate. There's no permanent surgeons in this area. So in the Klang Valley, from the public sector hospitals, the surgeons will take about once in every fortnight to come to this center to do the operation. And we realized that when we take this surgery out into this shop lot, and you only have one operation, the efficiency increase normally about 7 to 8 operations in a state hospital or district hospital. But when you come to this center, because there's only one surgery, the efficiency increase until 15 operations a day. So that's what we have done. Next slide, please. So again, I'm not able to show the slides, but more importantly is the reducing the complication. The more you do, the better you are. The complication rate, you can see, is 0% for the last 10 years. Next. And the outcomes, improving the outcomes is much better than even the eye hospital. This is about 94% in our Selayang cataract centers. Next slide. And this is what we do. There is a quality assurance, there is measurements in terms of direct and indirect measurement. Direct measurements will be the complication, indirect will be the operating time, admission, etc. So if it's acceptable, there will be a plateau. If it's unacceptable, the cases will go up. This is a trending of all the cases been done by the surgeon and by the department we can assess in terms of competency. Next slide. Here, this is a QSIM that we have actually published looking into performance monitoring for other procedures. Next. So if you can see, Dr. A and Dr. B have not achieved competency, but Dr. C have achieved competency after 20 cases, which means the doctor is competent. And here you can, the next slide, you look into the 3 trainees in the this is again, this is the cumulative sum for cataract. Consultant, you see the straight line. Trainee number 1, performance very good. After 10 operation, they achieve competency. Trainee number 2 have not achieved competency at all. Trainee have number 3 achieved competency about 6 cases after that. So this is the way that we measure competency. Next. So in other words, this is the direct impact of the competency in terms of acceptable performance. If the posterior capsular rupture less than 5%, so it's acceptable. Extra capsular cataract extraction more than 80%. If it's phaco emulsions, more than 85%. So this is our benchmark. So we acceptable benchmark and not acceptable benchmark, and then we can plot and look into the competency of the surgeons, competency of the procedures. Next slide, please. So this is the cataract operations that we have done, more than 30 operations a day, 2 operations theater, 2 operation operative rooms. So we do about 15 in each case theater. So all in all, we have done about 20 to 25,000 cases, and the outcome is excellent. Next. So it's high impact, reasonable cost, and good outcome. So that's the bus that we have shown, the low one. This is the mobile cataract services to the district hospital, and we perform the surgery there. And that is a shop lot. And this is with the 2 operating theaters. And this is how we finally manage to solve some of the problems, high impact, reasonable cost, and good outcomes. Thank you.
Thank you ever so much, Dr. Hisham. It's difficult to do justice to such an incredible piece of work in such a short amount of time, but thank you for taking us through that. I think this example that we're seeing around innovating a service delivery model particularly one that's traditionally been seen as the preserve of tertiary hospitals, is a great example of how, as we move into the future, we can start to rethink and redesign what health systems are, where they are, what they deliver, and particularly around what's delivered in the community. And this is a fabulous example of reducing cost, making services more accessible, doing things in a community that's more acceptable to the patients and the community, and doing it to a really high quality. So it's a fabulous example of how we can change things and still maintain the outcomes for the patients. Now, as we move on our journey, we're going to move into a more sort of strategic view of innovation, because innovation is not a single event. It's a series of implementation processes. And for any innovation to scale, it sort of requires a host of complementary changes and a system. The development of national innovation systems is really critical to ensure that new approaches and solutions, like we've just heard from Malaysia, are not just tried, tested, and they show really good impact, but they're sustained, they reinvent themselves, and they change systems and practices in health over the long term. Now, this is particularly true for digital innovation, which does require alignment across multiple sectors. So our next stop to hear a little bit more about the digital health landscape and innovation, I'd like to invite His Excellency, Dr. Lo Visanakiri, the Secretary of State, Ministry of Health of Cambodia, to share with us the design of the digital health innovation strategy. Dr. Kiri, the floor is yours.
Thank you. Thank you, Amy, honorable ministers and representatives, Dr. Gurin, and DPM's friend and college. Thank you for the opportunity to share the key feature of the Cambodian digital strategies. And also I would like to express our sincere thanks to the WHO for providing technical support and funding for the development of the digital health strategy in Cambodia. The Cambodia Digital Health Strategy 2023-2033 focus specifically on the role that the Ministry of Health, as well as the Royal Government of Cambodia at a broader levels, may play to maximize the impact of digital strategies on health and well-being of the Cambodian peoples. Next slide, please. There are a number of the key drivers for the digital strategies. Let me highlight a few of the key drivers. First is the policy drivers. The MOH commitment to build robust health information systems to generate complete, timely, and accurate and high-quality data. The strategy also develops in line with the national policy and strategies. In particular, the National Strategic Plan for E-Government 2018-2023, National Policy Framework for Digital Social Economy 2021-2025, as well as SDG 2030. The next Health Sector Strategic Plan 2023 has placed innovation at the enabler, cutting a codified strategic shift underpinning the strategies, in particular in the strategic shift on moving from providers to people-centered care and assessing innovations. Second, it is the technological drivers. There's been a rapid growing digital technologies in Cambodia. The coverage of the mobile phones, relatively low cost of the data, and also the coverage of the 4G and 3G coverage more than 80% of the population. And between 2000 and 2001, over 70% of the population use some form of social media. Last but not least, the digital economy played an important role for growth in Cambodia. There is interest in foresting the digital economy in Cambodia is high, as part of the strategy to achieve upper middle income status by 2030 and high income status by 2050. There are a high number of tech startups in Cambodia, estimated over 700 in 2020. Next slide, please. The digital strategy aims at providing a roadmap for digitalization of Cambodian health system over the next decades. Second, facilitate multi-sectoral collaboration on the digital governance, and also highlight the opportunity for the public and private partnership. Third, guide initiative and investment in digital health across the entire health system and streamlining relevant resources, stakeholder funding program and policy, given the current fragmented systems in the health sector in terms of the digital information system. Booster the reputation of the quality of care in the public sectors with a focus on strengthening primary health care to accelerate efforts toward universal health coverage. And finally, foster a learning system with a culture of continuous data, information, and evidence use for clients level decision making and system level policies making. Next slide, please. The digital strategies vision is better health for all Cambodians, enabled by digitalized and health deliveries. The strategy has come up with the intended outcome. First, every Cambodian will be identified by the unique permanent health identifiers, had a single line-long digital health record, and receive health services across the care continuum. Have access to their health record anytime, anywhere when needed, and use health records and digital educational resources to improve health literacies and outcomes. The other beneficiary of the digital health strategy also include the healthcare providers will have access to complete information regarding the client and patient, improve healthcare by using the clinical decision support tool, as well as use digital tools to identify and reach target population. The other beneficiary, the public health managers, will have access to up-to-date and multi-dimensional information to scale intervention across the population, and also to perform the appropriate analysis and the use of data to meet the goal and targets. And finally, every health policy makers will provide continued leadership and stewardship of the digital ecosystem, as well as empower appropriate governance structures of all digital health. Next slide, please. Here are the key examples of the digital health to strengthen primary health care. With the establishment of the unique health identifiers that underpin an electronic medical record, will support targeted integrated screening at the different stage of life, cost, and at the regular intervals. For example, knowing should begin and irregularities such as cervical screening for women age 25 plus every 3 years, or integrated screening for older people age over 50, including automatic reminders being able to send to relevant client. Second, improve ongoing NCD management, monitoring data on blood pressure and cholesterol management for hypertension or glycemia control for diabetic patients, and timing of follow-up visits and medication checks, etc. So, third, effective referral, including feedbacks and follow-up in PXC, where patient follow-up actions such as changing of the dressing. Basic health check can be effectively provided closer to the patient home, but require communication from the hospital back to the patient's local health center. And finally, feed the information from the patient health application, such as follow-up of symptoms and indicator for potential infection on return home, with the potential to link to quality monitoring, patient review of care process, more valid on the return home than if done at health facility. And finally, I would like to highlight only 3 points with regard to the capacity or the MOH, how we implement the strategy is very challenges. The first is the capacity in assessing initial feasibility, acceptability, and approaching of digital technologies. Second, the capacity in integration or the interoperability and the system integration to reduce the fragmentation and efficiency in the system, as well as the negotiation capacity to insist that principle of this integrated system. And last, develop and most importantly, monitoring and enforcement of minimum standard of the data privacy, confidentiality, and security together with other relevant ministries. I think.
Thank you very much, Dr. Kiri, for sharing with us the design of the Cambodia's upcoming digital health strategy and the aspirations that you have for the population of Cambodia and the healthcare service that they will receive in the future. It's exciting to see how innovation is central to the implementation of that strategy, and also how it's linked to all of the ongoing work around primary healthcare. This is a really exciting opportunity to accelerate many of the things in Cambodia around the health system, and we'll be keen to hear more of this at future events. Now, finally, from our sort of country journey, we are joined virtually by Ms. Chen E. Lee, the Group Director of Innovation and Transformation at SingHealth. This is Singapore's largest group of healthcare institutions, and she's going to share with us some of the experience that they have in Singapore around cultivating ecosystems to help develop and build and scale up health interventions in Singapore. Chinny, the floor is yours.
Thank you so much, Amy. Let me try to share my slides, and can you see this?
Yes, we can see it.
Wonderful.
Perfect.
So thank you very much again for inviting me to share our experience with such a distinguished audience and fellow speakers. My name is Chen Yi, and I head the Innovation and Transformation domain at SingHealth. So SingHealth is the largest public healthcare cluster in Singapore, with roughly 50% of market share amongst the public sector. With about 32,000 staff, we serve patients across the full continuum of care via our primary care clinics, 4 hospitals, 5 national specialty centers, and 3 community hospitals. In order to achieve our vision of defining tomorrow's medicine, we believe innovation is critical to transform and advance the care we provide for our patients. And we look at this innovation from various areas, such as quality, access. So waiting time, of course, is something that we're looking very carefully at, productivity, and safety. And our innovation efforts cut across different areas and across multiple clinical specialties. In clinical care, we look at diagnostics and therapeutics, for example. In the optimization of the patient journey, where we work directly with patients, like our SingHealth Patient Advocacy Network and our health colleagues, to fundamentally rethink our processes and our workflow so that patients and staff alike can have a more streamlined and better experience. Even though I've shown here some examples of digital transformation, we're always very mindful that not everybody is ready for digital tools. And so we always make sure that we cater to that group as well. In population health, we work with community partners to roll out new models of care and always trying to look at the social determinants of health. And of course, in responding to the COVID-19 pandemic, various innovations allowed us to care for our patients, COVID positive patients, with the constrained manpower. And SingHealth also endeavors to play a national role in healthcare transformation. We are grateful for innovation funding and support from government agencies like the Ministry of Health, the National Medical Research Council, Agency for Science, Technology and Research, Enterprise Singapore, and the National Health and Innovation Center. So this is why when we develop various innovations, we see it as our duty to share them for adoption by other healthcare clusters, and also for sharing and mutual learning with other public agencies. And I would say across the region as well. We are very, very happy to share, and therefore we want to again thank you for the invitation today. One example is the plug and play negative pressure isolation facilities. So beyond SingHealth, this innovation that was developed has been adopted by healthcare facilities in the National Healthcare Group and also in the private sector. Having previously held a role in infrastructure planning at the Ministry of Health in Singapore, I would say, that this innovation here on the left is important because it reduces that infrastructure cost. Instead of building a bespoke isolation room right from the start, it allows us to be very flexible, and then during a pandemic or depending on our needs, really be able to create that isolation facilities, negative pressure isolation facilities at a fraction of the cost within an hour. And then we have what we call SG Safe swabbing booths, here shown on the right, which allow healthcare workers to do swabs safely. And these have been also adopted beyond the public sector healthcare in army bases and dormitories, for instance. At SingHealth, we endeavor to create the conditions for innovation to thrive and to equip our innovators. For instance, we have multidisciplinary innovation clinics, which provide advice and some small seed funding to our innovators. We also bring together startups and innovators in something like speed dating events, to co-create solutions. With Duke NUS Graduate Medical School, which is our academic medical partner, we also formed an innovation institute that brings together innovation programs and offices to chart broad strategic directions based on priority areas that we have identified. And these include adoption and scaling of innovations, culture and human capital, emerging technologies and data, and co-development and test bidding. And this helps us to synergize assets and capabilities across the cluster, because monetary resources are always finite. So we don't want to duplicate some of these facilities or equipment. And we want to provide guidance in evaluating and prioritizing support for innovations, such as through an impact assessment unit that we have set up, which is staffed by health services researchers, and they evaluate potential impact of innovations. And the AMII Executive Committee brings together key leaders across the different domains and innovation offices to advise on innovation. And it is supported by the Innovation Council, which in turn comprises innovation representatives from different groups across the academic medical center. We also have steering groups to select innovations to scale up across the cluster. For instance, I co-chair a nursing innovation and transformation steering group with the group chief nurse of SingHealth, who looks after 12,000 nurses. And that's where we evaluate ground-up nursing innovations and also think about and strategize for cluster-wide nursing innovations that we want to adopt and scale. And there are many facets in innovation, and I thought it would be more concrete for me to give the example of one of our institutions, the Singapore National Eye Centre, which in fact is hosting a WHO workshop on eye health for all in the Asia Pacific region next week. And of course, Director General of the Malaysian Ministry of Health gave a wonderful presentation just now, and lots to learn from Malaysia as well. So Singapore is fortunate to be ranked highly in the Asia Pacific for eye research, and we think that the depth of research has actually been key to allowing the spin-off of various technologies across various areas at the Singapore Eye Research Institute. We see commercialization as not our key goal by any means, but really it's a way for us to broaden outreach of our innovations to more patients in different places, and also bring in that focus on sustainability and economic discipline. So this is where SNEC and SERI have been blessed with a strong technology and commercialization team, which has also enabled that commercialization and startups, and also that rich pipeline of R&D collaborations. Finally, we are very much still learning and welcome exchange of ideas and learning with other member states and healthcare systems. And my email address is here if you want to contact me. Many thanks.
Jenny, thank you so much for that rich presentation that covered so many innovations that have come out of the work that you and your colleagues do in Singapore. And I think what you've done is illustrated beautifully how the development of an innovation ecosystem can ensure that individual innovations that perhaps solve one problem that's here today can build and combine and transform health systems for tomorrow and the next tomorrow and the future, and how powerful that ecosystem can be in pushing the health system forward. So thank you very much for providing us with that perspective today. Now, I'm aware that one of our speakers was unable to join us on time earlier because there was a slight technical issue, but I am aware that Dr. Tsai is actually able to join us now. So just as a reminder to our audience, Dr. Tsai is the editor-in-chief of the Lancet Regional Health Western Pacific, and she's joining us from Beijing to talk about the collaboration between Wipro and the Lancet on a series of innovation papers that came out of the Innovation Challenge. So Dr. Tsai, over to you.
Yeah, thank you, Amy. And I apologize for the technical issue happened in my laptop just a few minutes ago. So dear representatives, distinguished guests and colleagues, it is my great pleasure to announce the launch of the special collection, Health Innovation in Public Health today. This is a joint project between the WHO Regional Office for the Western Pacific and the Lancet. It was formed to provide an overview of the health innovation applications to address the public health challenges in our region. The WHO, the Western Pacific region has the largest and the fastest growing aging population. Every year, 12 million people die from non-communicable disease, and more than 100 million people have a mental health disorder, but many of them receive no treatment. Countries are suffering high mobility and mortality driven by infectious diseases. We urgently need new methodology, technology, and approaches to address these healthy challenges. But questions such as how to develop an innovation to meet individuals and the population's health demands remain. How to monitor and evaluate the value of innovation when compared with traditional methods. How can we increase the engagement from different sectors to implement and develop and deliver innovation to those with greatest need? And how to take advantage of existing resources to scale up innovations that address the alarming health disparity and inequality. These are just some of the questions in regard to health innovations. Some are for academic research, but some others are important questions for developing effective and sustainable interventions, which would require strong political wills and coordinate efforts across the region. The special collection launched today with 9 viewpoints out of 29 winners of innovation for the future of public health, the first WHO Western Pacific Innovation Challenge. Authors from our region show the experience and the lessons learned from the development, implementation, and the delivery of health innovation to address those most urgent health challenges. We hope this special collection can pave the way to new insights, raise discussion, and contribute to realize the real value of healthy innovation that is accessible to a large group of people and meets the real-world needs. Finally, I would like to thank all our participants who have contributed to make this special collection to happen, and thank you for the opportunity for having me here today. Over to you, Amy.
Thanks, Dr. Tsai. We also hope that showcasing these examples of innovation that are in the special edition will reach a wide audience across the region and beyond, and motivates people both in the public and the private sector to explore innovative solutions for critical health issues. And a little bit of promotion for those who are here at the RCM who would like to access the special edition. There's a QR code which you can find outside the venue, so you can actually access straight away to the special edition articles that Dr. Tsai just talked about. Thank you very much, Dr. Tsai.
Yeah,
So
thank you.
just as a roundup to the session, we've been on a bit of a journey. We've gone through 3 countries, examples, looking at how innovation can fundamentally shift our thinking about how we deliver services, how we deliver high quality services, increase accessibility, reduce costs, and improve patient community satisfaction with those services. We've heard about how innovation is built into important aspects of digital health strategies that shape the way we look at health systems and primary healthcare in the future. And we've also seen an example of where building partnerships and developing an ecosystem can help take things that seem like individual projects across the health system that are innovating to solve problems and can actually be harnessed to show real health systems transformation. And I think finally, with the presentation of the special edition, you'll be able to see the enormous potential for innovative solutions, creative ways of thinking that there is across the region, both in the private and public sector. And with that, I would like to hand over to Dr. Kidong Park, the Director of Data Strategy and Innovation at the Western Pacific Regional Office, for the closing remarks in this session. Over to you, Kidong.
Thank you, Amy. Again, I want to thank everyone for being part of this side event, either in person or virtually. In the opening remarks by Corinne Capano, we introduced ideas about our world in transformation, the interconnected fragility revealed by health, economic, social, and environmental crisis, the demographic shift, digital transformation of society and the healthcare system. These forces shaping the future of the humanity are inevitable and must be embraced and managed. We also introduced that becoming an innovative state is the path we must take. Health ministries must take proactive role and be the value creator, investor, governor, and measurer. We have heard the speakers from Cambodia, Malaysia, and Singapore. And we have seen the special edition of the Lancet on health innovation. Their sharing articulated the criteria and the direction for innovation. They include high impact on health equity, good outcome at low cost, supporting the paradigm shift in health service delivery, namely the decentralization of the care from tertiary medical institutions to primary care facilities and communities. The stories they shared reinforce the active role of the health ministries, should assume to turn good solutions into truly transformative power through investment, institutionalization, and partnership. Over the coming years, the WHO Secretariat, we will, in consultation with you, regarding how WHO can best support you in innovation and transformation to future-proof countries, health system. Our next steps include the development of a regional strategy to accelerate health innovation and the formulation of the regional innovation hub that can partner with, coordinate, develop, and strengthen innovation ecosystem in countries and areas in the region. The world where we live, the world where we love, work, and play has been profoundly transformed. Let's take the passage to innovation together towards the healthiest and safe the region. Thank you. Back to Amy.
There we go. It turned green. Thank you, Kidong. We hope that each and every one of you listening in today has enjoyed the little journey that we've taken you on for the last hour. We'd like to really thank our speakers, Dr. Sai, Dr. Kiri, Dr. Hisham, and Chini for the time that you've spent with us today and the stories that you've shared and the inspiration that you've given the room. And as Kidong said, we hope that in the last 45 minutes, we've motivated and inspired some of you to join us on the innovation journey, and we're looking forward to working with you in the years to come. Thank you very much.
Thank you.
Lift us up, the world is changing. We must create a healthy future. Water pumps that don't need power.
គ្រូពេទ្យនៅមណ្ឌលនោះក៏គាត់ណែនាំឲ្យទៅថតអេកូមើលទៅជាស្ថានភាពយើងនឹងវាធ្ងន់ធ្ងរវាដុំនេះវាចេះតែចុកអត់បាត់ហ្នឹងគាត់ក៏លែងហ៊ានបើកថ្នាំឲ្យលេបដែរឲ្យយើងទៅថតអេកូមើលឬក៏ទៅធំអីចឹងឲ្យទៅវះកាត់ចឹងគាត់ណែនាំយើងបើសិនជាអត់មានមណ្ឌលសុខភាពហ្នឹងបងអត់ទៅដំបងបងមានតែផ្លូវស្លាប់មួយហ្នឹងព្រោះបងអត់ដឹងថាបងកើតជំងឺអីចឹងណាទុកជំងឺនឹងដល់វាធ្ងន់ធ្ងរខ្លាំងចឹងវាថាវាបែកវាកើតមហារីកចឹងអីវ៉ាន់ចឹងទៅព្រោះអីបើយើងអត់បានដឹងយើងអត់បានទទួលសេវាដែលគេណែនាំយើងចឹងណាអូននាមខ្ញុំឈ្មោះសុកវឿននាមខ្ញុំមានកូន2នាក់កូនអាពៅខ្ញុំនៅសិក្សាឡើយនៅរៀននាមខ្ញុំធ្វើជាអ្នកកាត់ដេររោងចក្រកាបូបនៅផ្លូវ41នាមខ្ញុំមានតួនាទីធ្វើជាប្រធានក្រុមគេបងសម្រាប់ការឈឺសម្រាប់បាន6ខែការសម្រាប់ពីការងារហ្នឹងអូអារម្មណ៍តានតឹងព្រោះយើងសម្រាប់ពីការងារយើងអត់មានការងារធ្វើហើយយើងឈឺហើយយើងអត់មានលុយទៀតយើងត្រូវចំណាយលុយថ្លៃផ្ទះជួលទៀតការហ្នឹងពិបាកសម្រាប់ខ្ញុំពិបាកមែនទែនកាលហ្នឹងនាងខ្ញុំទៅវះនៅពេទ្យកាលម៉ែតគឺវះដុំគិះហើយនឹងដុំពោះត្រឡប់ពីវះមកពេលវាពេទ្យនឹងវាឆ្ងាយពេកខ្ញុំក៏ទៅបើកថ្នាំនៅមណ្ឌលសុខភាពយើងគឺថ្នាំទៅលាងរបួសនិងបើកថ្នាំផ្សះលាបចាំ 3-4 ថ្ងៃតែបើកម្ដងមានមណ្ឌលនៅចិត្តផ្ទះអញ្ចឹងវាងាយវាងាយស្រួលអូនវាងាយស្រួលមកចាប់ដល់ពេលយើងឈឺស្កាត់យើងឈឺយប់ប្រលប់អីវាស្រួលវាចិត្តផ្ទះទៅមណ្ឌលសុខភាពរដងប្អូនជូនទៅអត់ប្អូនអត់នៅជិះម៉ូតូឌុបទៅបើសម្រាប់ខ្ញុំផ្ទាល់វាពិបាកឲ្យយើងទៅឈឺទៅមកឆ្ងាយវាឆ្ងាយវាពិបាកសម្រាប់យើងធ្វើដំណើរទៅមកអញ្ចឹងណាការទៅមណ្ឌលសុខភាពហ្នឹងខ្ញុំគេមានលោកគ្រូពេទ្យមួយសម្រាប់ទៅកត់បានបអសយើងសម្រាប់ខ្ញុំថាបានបអសហ្នឹងគឺសម្រាប់ខ្ញុំវាងាយស្រួលព្រោះយើងវាអត់មានថវិកាគ្រប់គ្រាន់សម្រាប់មើលជំងឺខ្លួនឯងអញ្ចឹងណាខ្ញុំរីករាយនឹងសេវាកម្មមណ្ឌលសុខភាពគាត់ណែនាំយើងមកគាត់និយាយតាមហេតុតាមផលគាត់អត់គំរោះគំរឿយគាត់ឲ្យមានទំនុកចិត្តថាគាត់យើងទៅគាត់បើយើងបានច្បល់មកល្អពីគាត់អីចឹងខ្ញុំធ្លាប់ឮគាត់និយាយថាពីបានបសហ្នឹងទៅប្រើទៅគេអត់មើលគាត់ដិតដល់ខ្ញុំដឹងថាកុំជឿគេជឿដែលយើងធ្លាប់ប្រើខ្លួនឯងអាមិនបានយើងដឹងទូទាំងប្រទេសហ្មងថាសង្ឃឹមថាមានបានបសហ្នឹងយើងប្រើទលំទលាយដូចយើងអ្នកមានលុយចឹងណាខ្ញុំចង់ឲ្យគេគ្រប់គ្នាមានទំនុកចិត្តដូចខ្ញុំមានទំនុកចិត្តលើបានបសអញ្ចឹងព្រោះការហ្នឹង
I hope you enjoy the lovely lunch that was provided. Now we will resume our consideration of agenda item 16, specifically 16.5 other items. It is my pleasure to invite the co-chair of the Intergovernmental Negotiating Body to draft and negotiate a WHO convention
agreement, or other international instrument on pandemic prevention, preparedness, and response, INB. Ms. Matsoso, who will join us online, as well as our region INB Bureau member, Mr. Takuchi, who travels all the way from Geneva to join us in this regional committee meeting to take the floor. Thank you.
Good morning. Thank you, Vice Chair, Regional Director, Ministers, Excellencies, ladies and gentlemen. It is my honor and privilege to address you, and thank you for inviting the INB Bureau as part of the consultations that we've been having with all the regional committees. Both Mr. Kazuho Taguchi and I, together with WHO Secretariat, we will be consulting you like we have done with other regions. This is the last region in a series of our consultations that we will be consulting. We've already consulted 5 other regions since our last sitting of INB2. So we're concluding the regional consultations with WIPRO. And as we conclude, we have to recall that we met for the first time in February to fulfill the mandate that you as member states have given us to come up with a working draft, as well as identify those sections in the WHO Constitution that will rely on for purposes of coming up with an international instrument or a convention or treaty. And between February and now, when the INB started its work, the 6 of us representing 6 regions, AMRO, Afro, Euro, EMRO, CRO, and WIPRO, we have worked hard to produce the working draft as you so requested. But it is not only the working draft that we had to come up with. It had to be a consultative process. It had to be inclusive. And in doing that, we had to be systematic in the manner in which we identify elements that would be included in the instrument. And Mr. Taguchi will address you. I would like to use this opportunity to thank you for your support, but also your commitment in ensuring that we could meet those deadlines that were set for us. It is yourselves and relevant stakeholders who provided those inputs and your submissions when we sent out the online tool to begin our work that actually helped us to achieve this goal and be where we are today. And Mr. Taguchi, who I am now handing over to, will do the presentation on behalf of the Bureau. Thank you very much.
Thank you. Thank you, Chair. Thank you, Co-Chair Precious. Ministers, Excellencies, distinguished representatives. My name is Kazuho Taguchi. Please call me Katz. I am a Minister Counselor of the Japanese Mission in Geneva. And before I posted to Geneva last year, I was a director for Global Health Corporation of Japanese Ministry of Health. I participated these RCM meetings 3 years ago. I'm pleasure to see familiar faces in the meeting. There, I confronted as a director for Global Health Corporation, confronted the issue of COVID and I was involved in the issues of cruise ships like Diamond Princess. And also I worked to create a framework of COVAX and vaccination sharing from Japan. Can we have a slides? Yes. As Co-Chair Precious Matsuo have already explained that I am one of the 6 bureau members from each WHO region. And you see the photo with Dr. Tedros. On the left, that is myself. And next to me, we have Dr. Biroji from Thailand. And next to Dr. Tedros, we see Co-Chair Precious Matoso from South Africa. And also we have next to her, Co-Chair Roland Doris from Netherlands. And we have next to him, Ambassador Tabo Noon from Brazil. And on the far right, we have Dr. Ahmed Soliman from Egypt. Let me explain objectives of today's meeting. Firstly, I would like to share update of the discussion we have in the INB. And I would like to explain the process we are having towards next INB meeting. And secondly, I would like to hear your views and inputs. And this second point, I think, is very important because our region, our UPRO region, has been affected by the COVID pandemic, especially in the earlier stages. And our region has unique characteristics, like we have many remote island countries. I think it is important that our view is properly reflected in new instrument. And thirdly, I would like to encourage your further involvement and commitment in this procedure. Because as I explained, it is important to reflect our region's view into the new instrument. And it is also important that to realize this new instrument, we need your political commitment for that. I arrived last night and I will stay in Manila today and tomorrow. Although I had an informal meeting with UPRO region in a hybrid format, but I think it is a very great pleasure to have a meeting in person and to profit from that. I'm willing to have a informal bilateral meeting if you are interested. And if you are interested, please contact me or my colleague in Japanese delegation for that. Okay. Let me briefly explain where we are now in the process. Well, for more comprehensive explanation, please look into the background information document prepared by UPRO Secretariat, that is RC73/INF/5. As you may have known, we have 2 parallel processes ongoing for for enhancement of global health architecture. First, we have an INB process. For the INB, we had already 2 INB meetings. And we are going to have a 3rd INB meeting in this December. And we're supposed to submit a progress report to the next WHA in May 2023. After negotiation, we expect to submit the outcome of the discussion to the WHA 77 in May 2024. There, we expect adoption of the pandemic accord. Another process ongoing is the IHR revision process. For this, member states are asked to submit a proposal for amendment by the end of last September. We expect that the working group on IHR will convene by 15th November. And after the round of discussions and negotiations, we expect to have adoption of the package of the IHR amendment at the WHA 77 in May 2024. In summary, in these two parallel processes there, we have same deadline for that. Next slide, please. I'd like to share with you what we have achieved till today. We have made two major achievements during the INB2 held last July. First point is that we collated the working draft, and member states expressed that this working draft is a good basis to facilitate the discussion, and also agreed to elaborate and present a document called Conceptual Zero Draft for the consideration in the next INB meeting in December. First, second achievement we have made during the last INB meeting is that we identified the provisions of the WHO Constitution. The member states agrees that new instruments should be legally binding and contain both legally binding as well as non-legally binding elements. INB also identified that Article 19, which is the article for the legally binding framework, was a comprehensive provision under which this new instrument should be adopted, without prejudice to also considering the suitability of Article 21, the article for regulations such as IHR. Next slide, please. Now I would like to share with you in more detail the content of the working draft. Next slide, please. First, I would like to explain the methodology we have taken. From February to July, we gathered and collected intervention from member states and the relevant stakeholders, as well as written input from them. We also had public hearings, and we collected inputs from that as well. After gathering and collecting all these inputs, we synthesized and grouped these inputs thematically. Please bear in mind that this document, working draft, is not a fixed document. This is a flexible document, living document, and which is intended to be descriptive, not prescriptive. Next slide, please. Upon the request from the member states, working draft stipulated a proposal for the vision of a new instrument. This new instrument aims to protect present and future generation from devastating consequences of pandemics on the basis of human rights, equity, human rights, and solidarity. It also recognizes the sovereign rights of the countries and the differences in capacities. It also pursues enhanced cooperation with a view to achieving a universal health coverage. Next slide, please. The working draft also identified possible principle for the instrument. There are 15 principles, and I will read it out. Okay, right to health, universal health coverage, respect of human rights, equity, One Health, transparency, accountability, solidarity, shared but differentiated responsibility and capacities, sovereignty, community engagement, inclusiveness, gender equality, non-discrimination, and respect for diversity. And last but not least is the right of vulnerable populations. I also would like to share with you that the importance of public health and the impact of growing threats such as climate change, is mentioned in preamble paragraph of the document. Next slide, please. This slide shows the objectives of the new instrument. Firstly, this instrument increase the capacity to prevent pandemics from occurring. Secondly, it aims to increase preparedness capacities. Thirdly, it aims to ensure equitable access. Fourthly, it tries to ensure improve pandemic response. And on fifth, to facilitate equitable restoration. So in summary, this instrument aims to increase global capacity through all phases of a pandemic, which means in preparing, preventing, responding, and in recovery. Next slide, please. Working draft also mentions about proposal for general obligations for member states. These obligations include elements such as development of review mechanism for pandemic PPR strategies, or the engagement of with civil society, cooperation with parties and international organizations, provision of information sharing, access to technical assistance, mobilizing resources, ensure finance and human resources, and cooperate to sustainable finance of the WHO, and support national implementation of the agreement. Next slide, please. The latter part of the working draft was devoted to more specific provisions and areas that include following elements. First one is equity. Second is access and benefit sharing. Third is health system resilience. Fourth is local production, governance, and health workforce on the sixth. And on the seventh, we have One Health, and climate change is referred in this in the context of One Health. In the on the right side, we have necessity for multi-sectoral actions, community engagement, global supply chain and logistic network, research and development, monitoring, and pandemic and public health literacy, and financing. Next page, please. And as we foresee that these instruments will be legally binding, we have also the working draft also contains elements for institutional arrangement and final provisions. Next page, please. Well, so as we have seen, there are many items and elements included in the current working draft. I would like to share with you some key issues to be discussed in the coming discussions. There are items frequently questioned or commented by member states. These are equity, or the issues like relationship with other international instruments, including the IHR, access and benefit sharing, and sharing that the differentiated responsibilities, One Health, local production and transfer of technology and know-how, IT issues, financing. These issues were very frequently mentioned or referred to the member states, and I believe these items will be the key issues in the coming discussion that we are going to have. Okay, next slide, please. I would like to share with you the significance and the implication of having a legally binding agreement. I think having a legally binding agreement will promote from a political commitment at the highest level, and also it will establish globally agreed principles, priority, and targets. And it will be the clear commitment to present and future generations. As it is mentioned in this slide, I believe that this can be a legacy to the future generation, and it is a commitment to minimize the impact of the future pandemics on our economies and societies. Next slide, please. So we have seen the contents of the working draft, and we have now, I have shared the significance of having a legally binding elements, and I would like to share with you now what the process we are having towards next INB3 in this December. Firstly, member states were asked to provide written comments on the working draft by 15th of last September. And as the co-chair of Precious already mentioned, we are having INB sessions in each of the regional committees, like we are having today, right now. This is the last one. And also we had informal meetings called informal forecast consultations on the topic, on the key topics for we invited experts and member states to deepen understanding in key topics. We also had 2 days of public hearings in the end of September. So now we are collecting collecting and gathering all the views and inputs on the working draft from member states, relevant stakeholders, experts, regional meetings, and the public. And as it was decided in the last meeting, now INB Bureau is developing the document called Conceptual Zero Draft. It will be shared with you shared with you by mid-November. We expect that this document, the Concept Zero Draft, can be a bridge between working draft and the future zero draft of the instrument. Third meeting of the INB will be held from 5th December to 7th December. We will consider the conceptual zero draft and will forward during the meeting. This is all from my part, and I'm looking forward to hearing your views and having inputs. I think it's important to reflect our views to this new instrument, and the discussion we are having today will be shared and reported by me and the Secretariat to the headquarters. And I would like to remind once again that I'm looking forward to having an informal bilateral meeting with member states taking this opportunity today and tomorrow. And if you are interested, please contact me or the Japanese delegation. I thank you. I give the floor back to you, back to the chair.
Thank you, Ms. Matsoso and Mr. Takuchi. We will now hear from representatives who wish to speak on this item or ask any questions to Ms. Matsoso and Mr. Takuchi. If you'd like to speak, please click the big button on your microphone if you are in the plenary, or use the raise hand function on Zoom.
Mr. Chair, colleagues, tēnā koutou katoa. Aotearoa New Zealand thanks South Africa for its leadership of the intergovernmental negotiating body's work towards a treaty or instrument on pandemic prevention, preparedness, and response. We also acknowledge Japan's contribution to this process as our representative, and thank you for the comprehensive update provided to the Regional Committee today. It's crucial that the Western Pacific region's member states share views on reforms to the global health architecture. A secure regional neighborhood in which countries are equipped with adequate pandemic preparedness and response capacity is a neighborhood better equipped to deal with future shocks. Aotearoa New Zealand is committed to actively engaging in the wide range of reform work underway. The INB has a central role in this process. We believe it is essential that the INB continues to work closely with the working group on amendments to the international health regulations, as well as the governors of the Financial Intermediary Fund, housed within the World Bank, to ensure the renewed system is fully coherent. Chair, making progress to strengthen the international system for PPR is the work of many. By ensuring that negotiations are inclusive and transparent, we can facilitate the engagement of all member states and design a system that works for all at domestic, regional, and global levels. Turning to the working draft of the instrument, Aotearoa New Zealand has recently shared text for inclusion in the next draft of the INB Bureau. Our submission outlined measures to improve international standards and accreditation of laboratories handling pathogens of pandemic potential, and a mechanism for sharing
pathogens, and genetic sequence data. These two suggestions address critical gaps in both pandemic prevention and response. They are also intended to mandate a future conference of the parties to establish mechanism and guidelines in these areas. We would be happy to discuss our suggestions with fellow member states and look forward to engagement ahead of the INB's third session in December. Thank you.
Thank you, New Zealand. Philippines, you take the floor, followed by Republic of Korea.
Thank you, Chair. The Philippines continued and active participation in the intergovernmental negotiating body processes. It proceeds with the important work of negotiating a convention, agreement, or international instrument on pandemic prevention, preparedness, and response. In relation to achieving equity, the Philippines would like to reiterate that it strongly recommends the inclusion of a language that highlights the cruciality of measures to provide shortages of health workforce of countries during global public health emergencies in accordance with the WHO Global Code of Practice on the international recruitment of health personnel. COVID-19 has exposed staffing gaps in some countries that are experiencing shortages even before the pandemic. The domestic health resources of sending countries were depleted by international response due to higher immigration rates. Therefore, it is critical to highlight the need for a coordinated policy action for the national mobility of the health professionals in building sustainable supply of domestic health workforce, strategies to address health security and promote equity. The Philippines will do its part to ensure that the global health sector is able to address the next pandemic and effective and equitable. Thank you, Chair.
Thank you, Philippines. Republic of Korea, you have the floor, followed by Australia.
We would like to appreciate hard work by the co-chair and Japan, which serves the Bureau member. With INB consultations within improving pandemic preparedness and response. The Republic of Korea emphasizes the necessity of legally binding instrument and health approach to prevent the genetic disease outbreak. We also like to discuss regional cooperation architecture, which ensures rapid data sharing and equitable and timely access to medical countermeasures. To supporting capacity improvement among regional countries. One of the outcomes for INB consultation is the working of IHR consultation on the region has been initiated. The consultation efficiently, reducing difficult and considering price, avoiding confusion between INB and IHR. Consultations that INB are considered together so that we can strengthen Western Pacific region's capacity of public health emergency preparation and response. Thank you, Chair.
Thank you, Republic of Korea. Australia, you have the floor, followed by China. Thank you.
Thank you, Chair, and thank you to INB Co-Chair Ms. Matsoso and Western Pacific Bureau Member Representative Mr. Taguchi for your update. Let me begin by commending you both, as well as your fellow Bureau members for the progress made so far. In particular, we welcome the agreement reached at the second INB that the new instrument should be legally binding. We see this as crucial for ensuring that all member states commit to
and are held accountable for pandemic prevention, preparedness, and response obligations in the collective interest. The comprehensive working draft prepared for IMB provided a sound starting point. We were pleased to see that a number of Australia's key priorities were reflected, including the strong focus on One Health and multi-sectoral coordination, supporting equitable and timely access to countermeasures, governance and whole of government and whole of society approaches, and preparedness with implementation, support, and follow-up, including a mandatory review mechanism. However, there are elements which we see as central to our collective ambition to strengthen the global pandemic prevention, preparedness, and response architecture, which merit further consideration for the conceptual zero draft. In particular, provisions on strengthening WHO's ability to rapidly access outbreak areas, the role of the quadripartite and member states in implementing One Health approaches and preventing zoonotic spillover, and strengthening global disease surveillance and sharing of information and materials. Strong, transparent, and coherent institutional and governance arrangements to support implementation of the agreement will be critical, ensuring we live up to our commitments, support one another, and are ready for emerging and future pandemic risks. The threat of emerging infectious diseases is ever present. Member states of the Western Pacific region have much to gain from this pandemic agreement, and we have much to contribute. We know that member states of our region are among the most vulnerable to the impacts of climate change. We must ensure measures to enhance pandemic preparedness are climate resilient. On a practical level, we encourage the Bureau to actively consider opportunities to better engage member states of the Western Pacific region, including scheduling of virtual meetings to take into account different time zones. We also encourage you to consider the capacity constraints of smaller and geographically remote delegations when developing Geneva meeting schedules, particularly as we move into the intense phase of negotiations next year. For our part, Australia will continue to participate actively in the INB, as well as the process to amend the international health regulations. We appreciate the opportunity to engage with the INB Bureau and note that we have sent some additional suggestions on One Health this week, as you encouraged us to do at the recent informal focus consultation. We look forward to working with other member states in our region to ensure our specific needs and experiences are reflected in this global agreement. Thank you.
Thank you, Australia. China, you have the floor, followed by Malaysia.
感谢主席团为推进大流行。
I'd like to thank the Bureau for the great efforts made in promoting the formulation of the treaty. China believes the health system monitoring capacity and emergency response capacity of countries serve as the foundation of global response to the pandemic. With different economic development levels in countries, countries vary in their participation in international social economic activities. We suggest that the treaty can promote the building of relevant mechanism to urge developed countries to step up its support and help to developing countries. With regards to financing, developed countries should take up more international responsibilities. Major developed countries should have a more responsible anti-pandemic policy and trade policy on anti-pandemic supplies to avoid unilateral sanctions or long-arm jurisdiction and avoid the spilling over of negative policy impact, which may deal heavy blow to developing countries. The formulation of the treaty should be fully aligned with the existing working mechanism. On the front of data sharing and virus sharing, we may refer to the practices of PIP, so as to ensure transparency of procedures and sharing of benefits. The less developed countries' interests should be paid special attention to. The dispatch of experts panel and contingents should follow the rules and the principles of the UN Charter and the Constitution of the World Health Organization, respect the sovereignty of relevant countries and respect the willingness of relevant countries. The cooperation mechanism should be designed according to the specific needs of relevant countries. The treaty should promote the building of an open technological and financing platform to fight the pandemic, remove technological barriers, promote the funding stock and technology application coordination at international, regional, and country level. Representation and right of say of emerging countries and developing countries should be improved to ensure equity in rights, roles, and opportunities. The formulation of the treaty should be fully scientific. We must uphold a spirit of scientificness in the pandemic response, safeguard human rights, rights to health included, protect the vulnerable groups, oppose politicization of the pandemic or stigmatization of the virus, and fight racial discrimination or ideological bias so as to firmly uphold international equity and justice. Thank you, Mr. Chair.
Thank you, China. Malaysia, you have the floor, followed by Japan.
Thank you, Mr. Chair. The Director General of WHO, in his opening remarks during the World Health Assembly second special session, which was convened end of last year, reminded us that in the past, countries can unite to negotiate a treaty against the human-made threat of tobacco, against the destructive potential of nuclear, chemical, and biological weapons, against the massive threat of climate change, and against so many other threats to our shared security and well-being. Indeed, the time has come for countries to agree on a common binding approach to a common threat that we cannot fully control or prevent, a threat that comes from our relationship with nature itself, particularly involving emerging and re-emerging pathogens at the human-animal environment interface. Malaysia believes that both the targeted amendment of the International Regulations 2005 and the establishment of the Intergovernmental Negotiating Body, INB, to draft and negotiate a historic global pandemic accord would be the beginning of our journey towards the establishment of a comprehensive, coordinated, and effective global response to future pandemics. In a world as interconnected as ours, COVID-19 pandemic has reminded us that we are only as strong as our weakest link. Moving forward, it is critical for us to identify and address the weakest links in our medical, financial, and economic systems. Only by strengthening these connections and improving cooperation can we establish a more resilient, responsive, and resistant defense against future emerging pathogens and viral threats. Thank you.
Thank you, Malaysia. Japan, you have the floor.
Thank you, Mr. Chair. As the Vice Chair of the INB, as well as the representative of the Western Pacific region, Japan has been putting our best efforts to the work of the Bureau, as well as to the coordination in the region. It is our role in this regional committee to listen to the views of member states, including small island states, to ensure their voices are heard. And we echo Australia regarding this point. Geographical and capacity consideration should be continued throughout the whole INB process. Japan appreciates member of the Bureau, the Secretariat, and all member states' contribution to the new international instrument on pandemic prevention, preparedness, and response. We particularly found the recent informal focus consultation very informative, allowing member states to study the challenges of the COVID-19 pandemic in depth. Japan supports the pandemic instrument to be a legally binding instrument under Article 19 of the WHO Constitution, containing both legally binding and non-legally binding elements. The instrument should contain universal health coverage in its preamble or general principles. UHC is a fundamental principle that contributes to building and strengthening response capacity at national levels, as well as building resilient health systems that can deliver essential health services to all people under public health emergencies. The instrument should clarify its relationship with the IHR. The INB should be mindful of the concurrent discussions on targeted amendments to the IHR to avoid any overlap and duplication. Aspects that can be covered by IHR amendments should be dealt in the IHR, and those that cannot be covered should be the elements of this pandemic instrument. Japan also expects a clear relationship between this instrument and the Nagoya Protocol of the Convention on Biological Diversity with respect to sharing of pathogens and genomics information and access and benefit sharing. This instrument should be carefully drafted so that it would not delay sharing of pathogen and genomic sequence information, which would ultimately affect the development of diagnostics, vaccines, and therapeutics. Thank you, Mr. Chair.
Thank you, Japan. Are there any more interventions on this item? Or any question to Ms. Matsoso and Mr. Takuchi? If not, I'd like to ask Mr. Takuchi and Ms. Matsoso to respond. Thank you.
Thank you very much, Chair. Thank you very much for all your intervention. It is very precious and valuable, reflecting our needs from our region. I would like to also thank a kind word for supporting the work of the Bureau, and also appreciate your support for having a legally binding instrument. New Zealand, Japan, and many countries mentioned about necessity for access and better necessity for better access and benefit sharing. In the Convention of the Biological Diversity, we have the Nagoya Protocol, but in the course of discussions, many countries pointed out it is not sufficient enough. So I hope that we can find a way for better access and benefits, better access and benefit sharing in the course of the discussion in the INB. New Zealand also mentioned about the necessity for the, to enhance the coordination between laboratories. And as I explained in my slide, during the COVID pandemic, we noticed rapid and timely development of the product is very important. So I think this enhancement of the capacity of the research and the development can be one of the very important elements in the discussion. I thank Philippines for raising the issue of the health workers. I think we learned from this pandemic that we need to have competent health workers, not only during the crisis phase, but from the non-crisis normal, daily phases as well. I think the pursuit of the UHC and having a resilient health system will contribute for that. And the other ROK and the other countries also mentioned about the importance of the complementarity between this new instrument and IHR. As I explained, that we are having two parallel processes for INB and IHR, and I believe that we will see how to manage these two procedures in the course of discussion. Or, if the development discussion develops, I think we will see more clearly what will be the separating line between the INB and the IHR procedure. And also we will find a way how to define the complementarity of these two instruments. I thank Australia for raising many important aspects like access of the WHO or the importance of the One Health and increase of the surveillance capacity. It is also important that for the reliable implementation of the reliable implementation of the instrument, we need adequate institutional mechanism to ensure member states' implementations. Our region, many of our region's countries are facing the challenge of the climate change, and this threat, this challenge is already somehow included in the working draft. But I think it's important that this point should be continued to be addressed in the coming discussions. Thank you. I thank China for raising many basic principles, possibly for the new instrument. And as you mentioned, that equity. I think that equity can be one of the key topic, central topic for this new instrument. And from that perspective, in the current working draft, we have the common but shared but differentiated responsibility as one of the principles. We also recognize the need to take into account sovereign rights of the member states. And also we need to, like other countries mentioned as well, we need to address the issue of intellectual property and the transfer of know-how in this new instrument to realize equitable access. I thank Malaysia for addressing the need that we have to address globally and prepare globally for the next pandemic that must occur in the future. And I also thank Japan for raising the importance of UHC. I think this is a key to have a robust health system, and and other issues such as thank you for raising other issues like relationship with other agreements, including the IHL and Nagoya Protocol. Well, I thank very much for these valuable inputs from member states, and this will be surely reported and shared with among our bureau, and it will be given due consideration for that. So now I think I would like to ask, I think the WHO Secretariat of Geneva is also joining remotely this session. And I would like to ask them if there's any technical points that they would like to add on my response. Thank you.
Good afternoon, colleagues. This is Stephen Solomon from Geneva headquarters. Can you hear me?
Yes, I can hear you, Steve.
Thank you. Thank you very much, Katzen. And thank you for that, that excellent description. We are here to respond to any questions that members of the regional committee might have. And let me start my video. I'm happy also to provide any specific additional information. So we are in your hands, as they say.
Okay, so, well, if there's any technical question, the member states would like to ask to the secretariat, please raise it. If there's no, okay, please.
Thank you, Steve. This is from Japan, a question from Japan. So in our intervention, we asked about the relationship between many other agreements. And we were wondering if you have any discussions with the CBD Secretariat, as I'm aware that there's going to be a conference of parties at the end of December. So I think it will be important for this INB to communicate closely with the other secretariat. So if you have any answers to that question, will be greatly appreciated. Thank you.
Sure, thank you. This is indeed one of the most important aspects of the work that's underway, which is the important issue of the relationship of any future pandemic convention or agreement with other international instruments. Of course, this is focused on the international health regulations, but the other instrument which follows quickly in terms of concern and relationship is with the Nagoya Protocol of the Convention on Biological Diversity. The Secretariat works extremely closely with the Secretariat of the Nagoya Protocol. We do so, of course, over many years with respect to the relationship of the Nagoya Protocol and the PIP framework. And we will, of course, continue to do so with respect to the ongoing work to develop the Pandemic Convention or Agreement. In fact, the Secretariat is exploring the idea of preparing a joint paper with the Secretariat for the Nagoya Protocol to address these issues. The issue generally arises with respect to the subject of a possible access and benefit sharing arrangement for pathogens with pandemic potential. And there are, of course, 137 parties to the Nagoya Protocol who will be very concerned that whatever is done in the context of the Pandemic Convention or Accord be consistent with their Nagoya Protocol commitments. So we will continue to work on this idea of a paper where we will work with the Secretariat to outline the specifics of that. I think what we can feel comfortable with is that given the broad interest among not only Nagoya parties, but even Nagoya non-parties to ensure coherence among the various relevant international norms, that there will be an effort which the Secretariat will support to ensure that coherence as the negotiations continue.
Are there any questions? I think there's no more questions. Mr. Takuchi.
Yeah. May I take over? Yes. Okay. Thank you very much, WHO Secretariat, and thank you very much for the response for the technical aspect. I would also like to take this opportunity to thank my colleague bureau members who are joining the virtually to this meeting, including Ambassador Tabo Nunes from Brazil. And now I would like to ask our co-chair, Precious Matsuo, to make a closing remark for this session.
Thank you, Mr. Taguchi. Actually, let me thank you for responding to all the questions and brilliantly so, and dealing with most of the issues that were raised by various member states, the Philippines, New Zealand, Korea, Australia, China, and Japan. I would like to mention that we have actually listened to you because you raised issues that relate to content with respect to the working draft. That would be very useful actually when we work towards the conceptual zero draft. So we've taken into account most of the issues that you've raised, but we've also raised issues that relate to process, particularly with regard to participation of member states from your region that would be constrained due to the geographical settings or capacity related constraints. And it is for that reason that we will continue to work with Secretariat to look at the possible and practical arrangements that fit all regions and that can be as inclusive as possible for all member states, because this is a process that is extremely important. COVID has affected everyone everywhere and in every part of the world, and our response should be that inclusive. I would like to also say that you have also suggested that there should be a process on how best we can continue to engage you between now and when we meet in December. And those informal processes, I think, will continue. We look at the practicality because now you recognize that we have the IHR review committee, we've got the working group, we also have the INB, and Secretariat is also preparing for the executive board. So, and we are preparing for December. So now to put all of that using the same Secretariat to provide support, I think would require a measured way of engagement so that we also appreciate the constraints that a Secretariat is faced with. But I appreciate the fact that you recognize the different instruments that are available that should be taken into account, and some of the responses that a Secretariat has provided. I think it's been wonderful, and Dr. Jawad, who is with us, has been steering this ship, and I would like to take this opportunity actually to thank Secretariat how competently they've provided support, and our bureau members who have consistently put their shoulders to the wheel to make sure that we can meet the targets that we've set us. And thank you once more for inviting us. And I wish you the best 73rd Regional Committee. I thank you.
Thank you very much, Mr. Takuchi and Ms. Matoso and Secretariat, for your contribution to this agenda item. Ministers, Excellencies, let's continue with item 11 on mental health. And I would like to call upon Mongolia. I would like to call upon Japan. You have the floor, followed by Mongolia. Thank you. This is the continuation of item 11 on mental health. Your intervention, Japan, you have the floor, followed by Mongolia.
Thank you, Mr. Chair. We welcome the ambitious regional framework, which not only seeks transformation and investment in the region, but also deals with well-being and aims to improve mental health in all settings and situations. Japan is also honored to have contributed to the development of the framework by sending experts and holding WHO symposium in Japan. Regarding the mental health promotion in Japan, we would first like to explain our footsteps in suicide prevention. In 2006, we adopted the Basic Act on Suicide Countermeasures. Suicide has been widely recognized as a social issue, and the national government became the hub and collaborated with the local government and non-governmental organizations. The number of suicides continued to decline from 2010 to 2019. Furthermore, to mitigate loneliness and isolation, which is considered to contribute to the increasing number of suicides, Minister for Loneliness and Isolation was newly appointed in 2021. To promote workplace mental health, screening of stress from work has been made mandatory in companies with 50 or more workers since 2015. We would like to share our experiences on these matters. Internationally, we are conducting several bilateral technical assistance projects in mental health, including a project on rehabilitation for stimulant users in the Philippines. We have also funded several mental health research projects with low and middle income countries through Global Alliance for Chronic Diseases, such as a study on workplace digital mental health intervention for nurses in Vietnam. Finally, we would like to see more investment on mental health systems and services and work towards universal health coverage, including mental health together. I thank you.
Thank you, Japan. Mongolia, you have the floor, followed by China.
Thank you, Chair. Mental health remains a major health challenge in my country. The age-standardized suicide mortality rate in Mongolia was 18.02 per 100,000 people as of 2019, according to the WHO's Mental Health Atlas 2020. Mongolia has a law on mental health, and the country implemented national programs on mental health between 2000 and 2009 and 2010 to 2019, respectively. Currently, the government plans to develop and implement a national targeted program on mental health for 2023 to 2030, with a strong focus on child and adolescent mental health. In May 2020, Mongolia launched a nationwide health screening program, which covers all population for early detection and screening of common communicable and non-communicable diseases, including mental, neurological, and substance use disorders. Currently, the government's total expenditure on mental health is estimated at about 2% of the total government health expenditure, and the majority of the mental health budget is spent on hospital-based mental care and services. The care and treatment of persons with mental health conditions such as psychosis, bipolar disorder, and depression is included in the national health insurance and state budget. Majority of the persons living with mental health conditions do not pay fee at the point of service use. Mr. Chairperson, from the year 2020, Mongolia started adapting and implementing WHO's MHGAP program. As of 2022, the two comprehensive MHGAP training manuals have been translated, adapted, and distributed to medical doctors of family and some health centers of 2 districts in the capital city and 3 provinces at subnational level.
The capacity building trainings have also been conducted in these districts and provinces according to the all modules of MHGAP program by the trained trainers and specialists of the National Center for Mental Health. My country has well-established health system infrastructure. Every district and provincial health facilities have psychiatrists, and some even have psychologists and addictologists. These present good opportunities to further scale up the integration of mental health into primary or non-specialized health settings. Though, in order to fully integrate, comprehensive measures need to be taken, including the adopting guidelines at the national level, making pharmacological interventions available at the primary care level, and so on. Mr. Chair, in September 2022, a mission on mental health by the Western Pacific Regional Office worked in Mongolia and commended Mongolia's efforts in strengthening the mental health care in the country and acknowledged its active role in the WHO Western Pacific region's process on the development of the current draft regional framework for the future of mental health. And my government remains fully committed to continue our efforts to realize the recommendations of this mission. On this note, Mongolia endorses the draft regional framework for the future of mental health in the Western Pacific. Thank you.
Thank you, Mongolia. China, you have the floor, followed by New Zealand.
Thank you, Mr. Chair. China supports this framework, draft framework 2023 to 2030. This framework will help the region to realize the highest attainable mental health and well-being. We would like to share two contributions. First, it is necessary to pay great attention to mental health from the legal and policy perspectives. In 2013, China issued the mental health law, which provides the legal guarantee for mental health. The Healthy China Action 2019 to 2030, as well as the 14th Five-Year Development Program and the 2035 Vision Program have been worked out and made specific arrangements for mental health. Second, we strengthened mental health system development. In particular, we have shifted to the community-based services. In recent years, mobilizing the efforts of various sectors, we have promoted the establishment of Department of Psychiatrics in the medical facilities and also the mental health clinics and the wards. We have also conducted relevant training and continuing education. The community-based services for mental health disordered patients are enlisted in the National Public Health Service. In 2016, we've also worked out specific guidance to promote mental health. China suggests to further intensify the exchange and cooperation within the region and also to get more support from WHO for mental health and also to promote the knowledge sharing in this regard. Thank you.
Thank you, China. New Zealand, you have the floor.
Chair, colleagues, Aotearoa New Zealand is pleased to see that the draft regional framework is well aligned with our domestic priorities for mental health and well-being. We support the framework's focus on equity, its people-centered, rights-first approach, and its prioritization of wraparound support that is innovative, community-led, and culturally appropriate. These principles underpin Kia Manawa Nui, Aotearoa New Zealand's first whole-of-government strategy and action plan to improve mental well-being. Kia Manawa Nui echoes the framework's call for strong social, cultural, environmental, and economic foundations for mental well-being. This multi-sectoral approach, combined with strengthened mental health and addiction services, is key to realizing an equitable and thriving Aotearoa New Zealand, in which mental well-being is promoted and protected. As we implement our health and disability systems reform, we are working hard to address missing components in mental health care. We know that without accessible pathways to early intervention, small issues can become big problems. Our newly developed Access and Choice program aims to close this gap by offering free and immediate mental well-being advice and support for people with mild to moderate mental health and addiction needs. This service is available through general practice, Indigenous specific and youth specific settings so that people can access help that works for them when and where they need it. Another challenging area with us is with offenders in our justice system with mental illness, alcohol, and other drug addictions. This work is being led by our judiciary, is called Te Ao Marama, meaning to move from darkness into the light. It is rehabilitative focused, providing clinical care and support to offenders and restorative justice opportunities with victims. These are just two programs that are being rolled out as part of our broader 1.9 billion cross-government mental well-being package. While meaningful change will take time and significant investment, Aotearoa New Zealand is committed to interrupting intergenerational patterns and unfair social structures that perpetuate stigma and stand in the way of mental well-being. We look forward to understanding how fellow member states are utilizing the framework as we collectively work to ensure that the people of our region enjoy the highest levels of mental health and well-being. Ngā mihi nui, thank you. I'm within 3 minutes.
Thank you, New Zealand. Ministers, Excellencies, now it's time for coffee break. 25 minutes coffee break, and we all back here, 3:45 sharp. We will start with Pacific mobility break before we continue with mental health issue. Thank you.
Thank you. We will continue with item 11 on mental health. I call upon Micronesia to take the floor, followed by Singapore.
Thank you, Mr. Chair. FSM supports the regional framework for the future of mental health in the Western Pacific. FSM supports the statement that we are facing a looming mental health crisis driven by social pressures, vulnerabilities, and unrest, and amplified by the wide-ranging impact of coronavirus diseases, pandemic on everyday life in communities throughout the region. We recommend that special attention be given to mental health impacts for women and girls in the context of its intersection with post-COVID-19 pandemic. FSM agrees that risk factors for poor mental health are present at all layers of society. At the macro level, these include large-scale conflict, economic downturn, social polarization, displaced populations, and the climate crisis. These threats impact the day-to-day reality of individuals, families, and communities, threatening their mental health and well-being. We recommend that impacts of gender inequality are included as a risk factor adversely affecting the mental health of women and men within their communities. FSM also agrees that community-based ecosystem approach to mental health support and care is important strategy. Thank you, Mr. Chair.
Thank you, Micronesia. Singapore, you have the floor, followed by Brunei.
Thank you, Mr. Chairperson. There is indeed no health without mental health, and Singapore supports the regional framework for the future of mental health in the Western Pacific. While Singapore has invested and made progress in mental health and wellness over the years, COVID-19 has magnified pre-existing mental health stressors and exacerbated diagnosis and treatment gaps. Now, to oversee and coordinate mental health efforts, focusing on cross-cutting issues that require interagency collaborations, Singapore established a new interagency task force on mental health and well-being last year. Allow me to share 3 preliminary recommendations of the task force. First, improve the accessibility, coordination, and quality of mental health services by tailoring care according to the mental health needs of individuals. Having diverse service providers in various settings, engaging in different care models would broaden the ability of the healthcare system to support the spectrum of mental health and well-being needs across the population. But they will need to be tiered according to needs, and those who need them must know where to access these services. Second, strengthen services and support for specific groups. Resources should be tailored for specific segments, such as youth, to promote cyber wellness and healthy use of technology, and equip parents to look after their children's social emotional well-being better. Employers could be equipped with knowledge to create inclusive workspaces to support persons with mental health needs. Third, improve mental health literacy and awareness through public education. To support mental health promotion and encourage help-seeking behaviors, more needs to be done. So mobilization of the public and creating spaces for dialogue and participation allow for the building of social capital for the future of mental health needs. Now, we have just completed our public consultation processes on these recommendations. I'm in the midst of incorporating this into a new national mental health blueprint. Our region has diverse range of social vulnerabilities and pressures that have significant implications on mental health. Singapore therefore supports moving away from a one-size-fits-all approach to a cohesive but diverse model of care delivery in a wide variety of settings. Thank you, Mr. Chairperson.
Thank you, Singapore. Brunei, you have the floor, followed by Malaysia.
Thank you, Mr. Chair. Brunei Darussalam would like to commend the WIPRO on the draft regional framework for the future of mental health in the Western Pacific 2023-2030, as well as WHO's continuous commitment and effort at many different levels on addressing mental health related issues and promoting mental health and well-being for all. Brunei Darussalam supports the mental health agenda must be reoriented with a system approach to also include well-being and also to focus in reaching the unreached. We concur with the notion that mental health support and care must be transformed to enable them to be part of everyday life and reinforced in familiar and community settings. We have made significant progress in several aspects of mental health promotion, as well as the management of mental disorders, including the implementation of Mental Health Act and the expansion of mental health services from previously only provided in the general hospitals to selected health centers in the community, with a strong emphasis on holistic care, community rehabilitation, and reintegration. We recognize that there has been an increase of mental health issues amongst adolescents and young people in the recent years, especially in the wake of the COVID-19 pandemic, where school and work closures, stay-at-home orders, and the general disruption of daily life appear to have created high levels of distress among our vulnerable young people. In our bid to improve our services, particularly in reaching the unreached, Brunei Darussalam has also introduced the National Mental Health Helpline called Hotline 145 in 2019, providing emotional and crisis support to all callers and ensuring continuous access to mental health assistance, especially during the pandemic in the absence of face-to-face consultations. Additionally, we have the formation of inter-ministerial cross-functional team for mental health under our multi-sectoral task force for health in 2019. It has helped facilitate cross-sectoral dialogues and efforts in addressing some of the upstream mental health policies and priority actions, particularly in promoting good mental health. Through this multi-sectoral effort, I am pleased to share that the Ministry of Health of Brunei Darussalam will launch the Brunei Darussalam Mental Health Action Plan 2022 to 2025 in the near future. Finally, Brunei Darussalam looks forward to continuous support in further strengthening our capacity in the many different areas of mental health actions still needing attention. Thank you.
Thank you, Brunei. Malaysia, you have the floor, followed by USA.
Thank you, Mr. Chair. The unprecedented COVID-19 pandemic has resulted in significant mental distress and worsening mental health of individuals due to various risk factors. And these risk factors include unemployment, job loss, financial difficulties, disruption in connectedness due to isolation, separation, and many more. Subsequently, this may result in various mental health issues, mental disorders, and suicidal behavior that require one to seek psychological and social support. Malaysia expresses our strong support for the regional framework for the future of mental health in the Western Pacific region, 2023 to 2030. And this proposed framework highlights the aspects of prevention and monitoring of suicide, the implementation of mental health and psychosocial programs, and the promotion of mental health and well-being. We are pleased to note that Malaysia's National Strategic Plan for Mental Health is in line with the proposed regional framework. Malaysia would like to share that we have undertaken several initiatives that include reinforcing access to mental health and psychosocial support services through the psychosocial support helpline, mobilization of counselors at primary health centers, psychological first aid training for the frontliners, including pre and post-deployment briefings for those mobilized to the field, suicide prevention training for first responders, mental health awareness and campaign across agencies, continuous engagement with other ministries and non-NGOs in mental health promotion and advocacy. And the most recent initiative in Malaysia is setting up the National Center for Excellence for Mental Health to minimize the gaps and focus on digitalization in the provision of mental health services. This center also will integrate public, private, and NGOs actions to enable sharing of resources of mental health experts to translate research findings for policies and program development. As the burden of poor mental health will continue to increase, we need to focus and strengthen our efforts and congratulate the Secretariat for preparing this framework. Malaysia stands ready to support and collaborate on this critical health issue. Strategic partnership is crucial in addressing mental health as it requires a holistic approach. Malaysia has forged an effective partnership with various agencies as well as non-governmental organizations in using a new social cultural community approach to providing mental health intervention. In addition, we are further strengthening the collaboration and cooperation with religious bodies to close the gap between patients and healthcare services. Thank you.
Thank you, Malaysia. USA, you have the floor, followed by Australia.
Thank you, Honorable Chair. The United States thanks the Secretariat for developing the draft regional framework for the future of mental health in the Western Pacific 2023 through 2030. This policy comes at a critical time. The pandemic continues to have far-reaching effects on the availability of mental health and psychosocial support services, especially for LGBTQI+ persons, youth, older adults, people with disabilities, rural and medically underserved areas, and other vulnerable populations. Access to services and delivery of care is vital, and in such, we must do more to expand access to mental health and psychosocial support services delivered via telehealth digital platforms, telephone, or similar mechanisms. Further work is needed to support intervention programs that are inclusive of all populations within the Western Pacific region. We appreciate the draft framework's emphasis on strengthening evidence-based practice and research and data to inform policies and service delivery. It is crucial to emphasize continued information gathering on mental health and psychosocial support infrastructure, access and continuity of care, and the support of primary and community mental health and psychosocial services. We encourage WIPRO to reinforce the integration of mental health and psychosocial support in social development contexts. Mental health and psychosocial support are vital to facilitating access to development programming and resources for those with mental health disorders. The pandemic made it clear the need to financially invest additional resources in promoting mental health, the behavioral health workforce, and to address the deep disparities in mental health outcomes due to inequitable access to behavioral health promotion, services, treatment, and care. Thank you, Mr. Chair.
Thank you, United States of America. Australia, you have the floor, followed by Papua New Guinea.
Thank you, Chair. The mental health and well-being of all Australians remains one of the highest priorities for the Australian Government. We are committed to implementing broad mental health system reforms to deliver a comprehensive, coordinated, consumer-focused mental health and suicide prevention system. In doing this, we seek to recognise and to respond to the specific mental health and well-being needs of priority population groups within the community, including those significantly affected due to their ethnicity, sexuality, age, or experience of trauma or violence. The development and delivery of culturally sensitive mental health and well-being services for our First Nations peoples through social and emotional well-being programs is a critical part of this. The Australian Government is also investing in a national strategy to address systemic, societal and personal stigma and discrimination of mental health, ill health. The new National Mental Health and Wellbeing Children's Strategy aims to address children and their parents or guardians' mental health. Consistent with our domestic approach, Australia endorses the draft regional framework for the future of mental health in the Western Pacific 2023 to 2030. We support its new vision, directional strategies and key actions. People in the region are suffering from increased levels of mental ill health due to multiple factors, including the effects of the COVID-19 pandemic and the growing climate crisis. These factors have a particularly heightened impact on youth across the region. These challenges have amplified the need to improve our mental health and suicide prevention systems to address this increased impact on mental ill health. Australia welcomes embedding mental health and care models into the community while emphasising the need for a rights-based, person-centred model. We encourage the integration of mental health care into universal health coverage and acknowledge the urgent need to address financial barriers to accessing mental health care across the region. Identifying the impact of socio-cultural factors on mental health and ensuring mental health-related services are reaching the unreached is critical to this work. We support the framework's consideration of appropriate care models for women, gender and sexual minorities, Indigenous peoples, migrants and other minority groups. We are pleased to see the framework's focus on reducing social structures that perpetuate stigma and create barriers towards requesting care. We feel it is vital to develop a full range of supports across the region to enable people with psychosocial disabilities to access the necessary services. Lastly, we suggest that community-based, person-centred, trauma-informed, integrated and interoperable services and programs need to play an increasing role in mental health, suicide prevention systems and service reforms. Thank you.
Thank you, Australia. Papua New Guinea, you have the floor, followed by Samoa.
Thank you, Chair, for giving PNG the opportunity to make an intervention on this agenda. The world has become smaller through globalization, and member states in the Western Pacific are facing a looming mental health crisis resulting from social, economic, environment, and cultural factors. Such factors are internal and unique as well to respective member states present in this meeting. PNG is confronted with many mental health and social changes issues, such as issues associated with our cultural beliefs and practices such as sorcery, tribal fights, breakdown in family marriages and relations, including health, emergencies and disasters, and drug and other substance abuse. PNG has less than 10 psychiatrists and up to 60 mental health nurses scattered throughout the country to about 9.2 million people, where about 60% of these people are within the age range group considered as young and adolescent. There is only one dedicated psychiatric hospital located in the capital, far away from the rest of the provinces. And most provinces don't have a dedicated psychiatric ward or clinic. Accessibility to common psychotropic drugs remain problematic, leading to high numbers of relapses and deterioration of patients with severe mental disorders. In short, this is grossly inadequate to reduce current mental health treatment gap. Huge service gaps exist at the primary level, care level, where about 87% of the 9.2 million people live. PNG is doing all it can, and it has prioritized mental health in the National Health Plan 2021 to 2030, and it will work towards increasing workforce in this area. We need more social rehabilitation workers, counselors, mental health nurses, and psychiatrists to cover the entire country to ensure we do not leave anyone behind. Chair and colleagues, whether our people in the Western Pacific region live in the towns, cities, or villages, this is irrelevant. We all live in a rapidly evolving society. Changes in the digital space, IT, and globalization, including social, economic, political, and environmental and cultural landscape, affects us all, and we must be vigilant. With these few remarks, PNG support this roadmap and thank the regional office for the leadership in this space. Thank you, Chair.
Thank you, Papua New Guinea. Samoa, you have the floor, followed by France.
Thank you, Mr. Chairman. Mental health is an important aspect to every person's life, together with physical and spiritual health. We also firmly believe that good mental health is essential to learning environments and is often left out of health and social development policy making. Mental health remains one of the challenges for Samoa that arise from social pressures, vulnerabilities, conflict, displaced populations, and the climate crisis. These threats are reality to our families and communities, threatening their mental health and well-being. Mr. Chairman, Samoa is in the process of reviewing its previous mental health policy and in early stages of developing a strategic policy for mental health. We would also like to acknowledge the technical assistance received from the Western Pacific Region Office in this regard. The experience of health emergencies and disease outbreaks has had a profound effect on mental health. The experience of Samoa during the measles epidemic and the COVID-19 pandemic increased the need for psychosocial and support services. Samoa continues to face the challenge of the gap in mental health expertise and looks forward to learning from other countries' experiences in this area, as we feel we still have a lot to learn if we are to address this effectively. The Western Pacific region alone is prone to all forms of disasters, whether natural or man-made, as a result of progression and industrial development. As with Samoa's experience with disasters comes health emergencies and exposes our population to high levels of stress and anxiety over a long period of time. To be effective, we believe that embracing a system approach to mental health is crucial to providing support and care across different settings. Mental health support is crucial for Samoa. We try to use the family and community-oriented model, which is consistent with cultural and religious beliefs in assisting with mental health services. Mr. Chairman, partnership with civil society is important through the church, community, and mental health affiliated NGOs to ensure everyone has a role to play in shaping systems and structures to benefit mental health for all. We find that this model is crucial in addressing mental health in the context of Samoa. Samoa furthermore acknowledges the regional framework for the future of mental health in the Western Pacific region 2023 to 2030 and recommend the endorsement of this important document to assist with the national policy direction of mental health. Thank you very much.
Thank you, Samoa. France, you have the floor, followed by Solomon Islands.
Je vous remercie, Monsieur le Président.
Thank you, Mr. Chair. France feels very strongly about mental health. In 2018, it wrote a roadmap for mental health, which had envisaged the change of mental health and psychology. Furthermore, we also have a ministerial think tank that has been in existence since 2019, and France recognizes that the new regional framework for mental health is going to play a fundamental role for the well-being and health of people. And it's because of the very high levels of mental health. Nonetheless, we think it would be important that we also, the interpreter apologizes, the sound is extremely bad.
Thank you, France. Solomon Islands, you have the floor, followed by Palau.
Thank you, Chair. The regional framework of mental health for the Western Pacific 2023 to 2030 will link up well with our new National Strategic Plan 2022 to 2031 that we will be launching next week. Solomon Islands recently made amendments and approved its new mental health policy 2022. The need to make amendments for a more comprehensive policy direction was based on the challenges in addressing mental health in the Solomon Islands and the impact of COVID-19 pandemic. However, there remains challenges as the need for specialized health staff for mental health, human resource capacity building, primary health care services for mental health to conduct outpatient services and community outreach services. There is also the need to increase the current capacity of inpatient clinical services, noting that there is only one health facility that has a 20-bed capacity for our mental health inpatients. Apart from the challenges faced in the provision of mental health services, it is recognized that the governance, legislative, and resource mobilization arrangements to address mental health is equally important. Hence, the amendments to the Mental Health Policy 2022 recognize the impact of health emergencies in Solomon Islands on the Solomon Islands population, most notably the impact of mental health brought about from the COVID-19 pandemic. Furthermore, the revisions to the Mental Health 2022 is taking into account the need to progress with a new mental health bill in Parliament and emphasis for more resources needed to be invested in mental health interventions and strategies. The country, through the Ministry of Health and Medical Services, has reviewed regional framework for the future of mental health in the Western Pacific 2023 to 2030 and applauds the comprehensiveness and visionary approach it has within. And it is pleasing to note that the Solomon Islands Mental Health Policy 2022 is already aligned to the framework. The Solomon Islands look forward to the implementation of the regional framework for the future of mental health, and the country looks forward in anticipation for the strong partnership with WHO, WIPRO office in addressing its mental health through capacity building, policy, legislative, and resource needs. We therefore welcome and endorse the regional framework for the future of mental health in the Western Pacific 2023 to 2030 as the framework, and look forward to the support from WHO on addressing mental health in countries in the region. Leana Hola, and thank you so much.
Thank you, Solomon Islands. Palau, you have the floor, followed by Republic of Korea.
Thank you, Chair. Honorable Chair, esteemed colleagues, ladies and gentlemen, good afternoon. Since the declaration of the COVID-19 outbreak as a public health emergency of international concern, communities and people around the world have been through mental distress, anxiety, fear, and fatigue at levels unprecedented. In addition to the fear and uncertainty of COVID-19 as a disease, communities, families, and children were also greatly affected by the stressors brought about by response measures to the pandemic, including border and school closures, lockdowns, social restrictions, and the politicized aspects of the pandemic. These fears led to unhealthy coping mechanisms and risky behaviors, including increased use and abuse of alcohol, tobacco, and other substances, which in turn have led to increases in unintended accidental deaths and self-harm incidents. Last year in 2021 in Palau, we saw that about 1 in 5 of the youth between the ages of 9 and 20 suffered moderately severe or severe depression. About 3 in 10 admitted to considering self-harm or suicidal action, and 1 in 5 said they followed through with attempts. These numbers are truly alarming and justifies the need for more insight on ways we can deploy more effective and equitable strategies for mental health well-being, especially for the youth population in our region. Palau thanks the WIPRO Regional Office for its participation during the recent 29th Masil Velau or Palau Women's Conference, where they presented on mental health and healthy aging strategies. We also value and appreciate the support and resources that the WIPRO office, especially the Northern Pacific office, has provided throughout the pandemic, which have enabled us to implement key mental health initiatives such as critical incident stress debriefing, critical incident stress management, and self-care activities for our first responders. It is critical to ensure that as we continue to seek ways to improve mental health services in our communities, it is imperative that we also allocate the necessary time, effort, and financing to take care of our own healthcare workers and frontliners. For they too are people, they too are vulnerable, and without them, we simply cannot function as public institutions. We also commend fellow member states for the collaborative efforts leading to the development of the proposed framework in our region. From these efforts, it is evident that we need to scale up effective and rights-based strategies to ensure that communities, families, and children gain adequate knowledge and skill sets necessary for mental health resiliency and wellness, especially during and after pandemics and natural disasters. With this honorable chair, the Republic of Palau strongly supports and endorses the proposed regional framework for the future of mental health in the Western Pacific. Thank you.
Thank you, Palau. Republic of Korea, you have the floor,
followed by U.S. territories. Thank you.
Thank you, Chair. Since COVID-19 pandemic outbreak, not only Korea, but also the entire world has witnessed increasing number of people living with mental conditions. Mental health problem and suicide mortality rate for people in their 20s and 30s has been rising, and Korea has been struggling to resolve this issue. Also, following COVID-19 crisis, drug use has greatly contributed to the death among youth and younger generation, which requires early intervention. Building on the regional framework, we hope to overcome such emerging threats to mental health and well-being together with Western Pacific member countries. As the regional framework emphasizes, in addition to providing support for people with severe mental illness, we need to establish strategies to promote mental health and prevent mental illness for general population. In order to deal with increasing mental health issues, following COVID-19 pandemic, Korea has been implementing disaster psychological recovery support program at community level, and under the second basic plan on mental health and well-being announced last year, we have been expanding programs for the public to promote mental health and prevent mental illness. We have endeavored to provide life cycle specific services and programs tailored to personal characteristics so they enable easy access to mental health service in daily life of different settings. We are also improving access to mental health services for people suffering from severe mental disorders. While improving the environment of healthcare facilities and providing mental health services with a human rights-based approach, we have established integrated service delivery system based on community and supportive recovery and self-reliance in community. As a regional framework suggests, the field of mental health alone is not enough to resolve mental health issues. In this regard, Korea has also strived to approach mental health problems in integrated and comprehensive way via communication between central and local government and multi-sectoral collaboration. Additionally, as mentioned at panel discussion on regional framework last March, we would like to reiterate the necessity of digital technology utilization, socio-economic and cultural context-based tailored service, and mental health narrative change. Thank you.
Thank you, Republic of Korea. U.S. territories, you have the floor, followed by Cambodia.
Thank you, Chair. Distinguished ministers and guests, many efforts have been achieved and realized in the integration of services. And while this is true, there remains work to further integrate services, is in the work of accessing and education of mental health services. The effort to integrate mental health services to non-traditional settings is critical in the overall response to address socioeconomic challenges such as economic downturns, poverty, increased drug use, and adjustment to the discontinuance of government support from public health emergency COVID-19 funds. The recognition and integration of health and mental health services can produce favorable outcomes as both one's health and one's mental health coexist that affect the individual, the family, and communities to access health and mental health services or mental and health services interchangeably. As with many interventions and integration efforts, we must use and support a multi-sectorial approach to ensuring our community's mental health well-being direction is one that is moving forward. By building our cross-sector and multi-sector efforts, we will form a coalition, a community that recognizes the value of productive members to realize their full potential. We must strive for a well-functioning community that will prepare us to embrace with greater ease the next public health emergency. COVID-19 brought to light the critical soft spot of how our people perceived and managed a worldwide health crisis as they sought and needed mental health services. COVID-19 magnified the mental health stressors our community was managing without necessarily the support from formal mental health services. prior to the onslaught of COVID-19. Guam, Commonwealth of the Northern Mariana Islands, and American Samoa, in absentia, recognizes the need for us to refocus our efforts in the work of mental health services and increase the opportunities for our communities to access and receive mental health services. We commit to work in the transformation of services that is even more culturally relevant and practicable, such as community-based mental health services, while recognizing the necessary steps to build our workforce capacity and work to embed mental health services in public health sector services. Guam, Commonwealth of the Northern Mariana Islands, and American Samoa support the regional framework for the future of mental health in the Western Pacific 2023-2030. Thank you, Chair.
Thank you, U.S. territories. Cambodia, you have the floor.
Cambodia would like to comment on mental health. The Department of Mental Health and Substance Abuse of the Ministry of Health established and took leading role in the development and implement of mental health and substance abuse strategic action plan is to provide a strategic direction for development of mental health and substance abuse program activity for 2023 to 2030 in conformity with the National Health Strategic Plan 2023-2030 of the Ministry of Health. 1,021 provincial hospital, district referral hospital, and health center in 24 province and Phnom Penh City can provide mental health and psychosocial support as of September 2022. Health staff and village health support at subnational level gain knowledge and skill on mental health and psychosocial support, and to enable them to assist and to provide appropriate mental and psychosocial support to vulnerable population, including returning migrants and in their community as a part of COVID-19 response. And investment in the support will contribute to safer and healthier future for all Cambodians. Department of Mental Health supervise and increase the mental health service delivery at health center and district referral hospital and mental health psychosocial support counseling at outpatient services. Ministry of Health support the implementation of the National Strategic Plan on Mental Health 2023-2030 and operational guide on psychological first aid in school in line with the regional framework of mental health. Cambodia appreciate and support the draft of regional framework on mental health. Thank you so much.
Thank you, Cambodia. Are there any more intervention on this item? If not, I understand that the following non-state actors have submitted a video statement to the committee on this agenda item: Alzheimer's Disease International and World Vision International. Secretariat, let's play the video, please.
Honorable Chair and distinguished delegates, my name is D.Y. Suharya. I am the Regional Director, Asia Pacific, Alzheimer's Disease International, a federation of 105 Alzheimer's dementia associations from across the world. We would like to commend the WIPRO Secretariat and member states for the focus of this agenda item, mental health. ADI is particularly pleased to note the numerous references to Alzheimer's disease and other forms of dementia within the regional framework for the future of mental health in the Western Pacific 2023-2030, as well as the specific mention of its inclusion within the Convention on the Rights of Persons with Disabilities and the Global Action Plan on the Public Health Response to Dementia. As such, through Objective 1 of the regional plan, we encourage all WIPRO member states to develop and implement a national dementia plan following their unanimous commitment at the 70th World Health Assembly in 2017. Dementia is a non-communicable disease which currently affects 55 million people across the world. 26 million people with dementia lives in the Asia-Pacific region. WHO estimates predict that this number is set to increase to 139 million globally by 2050. Additionally, those living with dementia and carers frequently report poor mental health, an issue and comorbidity understood and often missed by healthcare practitioners. It is for this reason that we encourage all member states to act without delay to address this public health crisis. ADI strongly believes that dedicated, funded national dementia plans created by expert, multidisciplinary teams, including those living with dementia and their carers, is the best and most robust way to manage the multifaceted challenges of dementia to healthcare systems, to governments, society, and of course, to those people directly impacted by the condition. Thank you.
Honorable Chair and distinguished delegates, the draft regional framework for the future of mental health in the Western Pacific highlights the need to refocus the mental health agenda to include well-being and reaching the unreached, to transform mental health support and care into a community-based ecosystem, and to embed mental health into settings of daily life by engaging and empowering communities. We commend the emphasis on these focus areas and support the intent to empower community in mental health so that everyone can take part in creating this well-being ecosystem. We want to stress the importance of the caregiver's mental health on early childhood development. Last November 2021, the WHO and UNICEF Regional Conference on Ending Violence Against Children underscored the effect of maternal depression on poor early childhood development. With the COVID-19 pandemic, there has been a documented increase in violence against children and women. Moreover, there is a serious gap in the referral of mental health issues, as many countries in this region do not have enough trained health workers to respond to mental health issues in primary healthcare settings. In line with the focus to engage and empower communities, we urge member states to strengthen collaboration of health, child protection, and social welfare sectors to build capacity of alternative cadres in psychological first aid or PFA competency, such as social workers, community volunteers, and faith-based organizations. Intensify home visits or group sessions for caregivers of young children to coach them in self-care methods and integrate psychosocial care. In these visits or sessions, include identification and referral of abuse and mental health issues in children and caregivers. Strengthen prevention of violence against children and women as a collaboration of government with faith-based organizations, civil society organizations, and community volunteers. Thank you.
Thank you very much. All written and video statements from non-state actors and observers on this agenda item will be uploaded to the RCM webpage. As statements reflect solely the views of the NGOs concerned, it follows that statements do not necessarily reflect the views of the WHO, including its member states and secretariat. May I now call upon Dr. Hung to respond to the points that have been made. Thank you.
Thank you very much, Mr. Chair. I would like to thank our member states for reaffirming their commitment to mental health and supporting the regional framework for the future of mental health in the Western Pacific. Guided by the For the Future vision, the new framework is the outcome of nearly 3 years of journey and presents a bold new vision of transformative environment that promotes mental health for all. Indeed, there is no health without mental health. And in our region, mental health is everyone's business. Excellencies, thank you very much for your insightful comment, and intervention. Please allow me now to highlight some key themes from our intervention and discussion. First, we take note of the challenges facing the future of mental health, such as fragmented mental health services, limited resources for mental health, including human resources, the impact of COVID-19 and other emergencies on communities and people's mental health and well-being, increasing risk of suicide and other mental health disorders, the need to protect the vulnerable segments of population, such as young people, women, and girls. And of course, the cross-cutting concern between mental health and other important public health issues. We look forward to working closely with member states and partners in addressing these and other future challenges together. Secondly, leadership and governance and policy reform will be key to reorienting the mental health agenda toward well-being for all people. In this regard, policy action taken by member states in Australia, Brunei Darussalam, China, Laos, Malaysia, New Zealand, the Philippines, Solomon Islands, Kiribati, and Vietnam that are already aligned with the framework that are very encouraging. WHO stands ready to provide technical support, including the development of evidence-based guidelines and tools, strategic advocacy to ensure an optimal policy environment for mental health. Thirdly, mental health services must be delivered at the community level where people live, work, and encompassing health and social services. Already, we are seeing member states move towards this direction, which is exemplified by programs, activity, and services mentioned in Japan, New Zealand, Cambodia, Republic of Korea, Palau, the Philippines, Singapore, and Samoa. Pursuing synergy with other regional framework and strategies, particularly for primary health care, NCD, and reaching the unreached, will support this cross-cutting theme. WHO will continue to work with member states and partners in strengthening mental health systems, supporting training and capacity building of both specialists and non-specialists in order to deliver the full range of services to promote, protect, and restore mental health of our people. Fourthly, multi-sectoral engagement and mobilization of community access will be key to promoting mental health for all. There are good examples of family and community-oriented approaches and setting programs in China, Tonga, the Philippines, New Zealand, Palau, and Korea. WHO will provide the support for engagement beyond the health sector at all levels of government and the community to enable the truly whole of government and whole of society response. Last but not least, innovation and ground-up approach will be critical. Clearly, there is so much we can learn from each other's experience, and the region is ground for innovation in mental health, such as the digital mental health and community-based model and care supported as highlighted by Brunei Darussalam, Malaysia, Australia, Japan, and Mongolia. Partnership will be key to the implementation of this new framework. Our member states have a leadership role in this regard, and we take note of the request of further regional collaboration in this area. WHO will support the documentation of best practice and provide the platform for us to continue learning from one another to ensure that the lessons learned are carried on into the future. As a part of implementation, WHO is committing to working closely across 3 levels of the organization and with our network of WHO collaborating center, experts, and other partners. Among the framework's cross-cutting principle is due consideration for each country context, respecting local wisdom and insight. Now, I would like to give the floor to Dr. Deborah Festem, Director of Mental Health and Substance Use, WHO Headquarters, to share her remarks. Deborah, the floor is yours.
Thank you. Thank you so much, Dr. Won. I hope you hear me well.
Yes.
Great, thank you. And good day, Excellencies and ladies and gentlemen and colleagues from WHO headquarters. I really welcome the development of the regional framework for the future of mental health in the Western Pacific, 2023-2030. And as you have highlighted and mentioned several times, the pandemic has really badly impacted and has shown how the situation of mental health services and care in general is in many countries, and how services have been neglected and underfunded. So even before the pandemic, we have estimated 1 billion people, almost 1 billion people struggling with a mental health condition. So now the situation is exacerbated. And despite these clear needs, most countries continue to allocate very little funding to mental health, whether it is for promotion and prevention or for treatment and care. So it is great to hear the commitment from the region to advance in an area that has been lagging behind. And we hear with pleasure and we commend the efforts from countries in different relevant areas that were just summarized by Dr. Wong, whether it is a new action plan or training to ensure proper mental health integration at primary care, rather than specific areas of concern such as suicide prevention or groups of vulnerable conditions or focus on youth. We are pleased also to notice that many of our tools are useful to you. So some countries continue with their ongoing efforts, and new countries are starting a new clear effort to improve the situation. Globally, last year was the time for the European region to come up with a regional strategy, a coalition for mental health. This year, we heard already in the regional committee a framework for action on mental health in Afro, in PAHO with a new policy, CIARO with a PARO declaration, and now WIPRO. So this is a clear proof of the commitment from member states all over to advance in this area. We recently launched the WHO World Mental Health Report, Transforming Mental Health for All, as a call to move beyond the awareness that mental health matters into action that should lead transformation. In the report, we suggest 3 pathways to transformation that are clearly aligned with your priorities as highlighted in this regional framework. So first, we must deepen the value and commitment we give to mental health as an integral part of our own health and well-being, a basic human right and a critical contributor to public health, social well-being and sustainable development. But with the value should come the commitment that should be translated into also financial support. Second, we must reshape environments that influence mental health in ways that reduce risks and strengthen protective factors so that everyone has an equal opportunity to thrive and reach the highest attainable level of mental health and well-being. And third, we must strengthen mental health care so that the full spectrum of mental health needs is met through a community-based network of accessible, affordable, and quality service and supports. Excellencies, colleagues, ladies and gentlemen, we are not talking about an unknown virus here. We know, and you know, what needs to be done in this area in order to ensure that mental health is effectively and once and for all part of universal health coverage. Your commitment and your investment is needed. And WHO, across all 3 levels, will continue and hopefully will increase our support to member states to strengthen the capacities that you have to answer to the mental health needs of the population in this region. So I thank you deeply for this opportunity, and back to you, Dr. Wong.
Thank you very much, Deborah, for your encouraging and supporting words. Once again, thank you very much, Member States, for your support and commitment to the regional framework for the future of mental health in the Western Pacific. I now hand over back to Mr. Chair. Thank you very much.
Thank you, Dr. Hong. If there are no further comments, may I request the rapporteurs to draft an appropriate resolution. That concludes our consideration of this agenda item. Thank you very much. Ministers, Excellencies, we'll now move to agenda item 15, progress report on technical programs, document WBR/RC73/11. As mentioned on Monday, member states are requested to combine their intervention on the progress report. May I request the Director for Program Management and the WIPRO technical directors to introduce the progress report. Thank you.
Thank you, Mr. Chair, distinguished representatives. I am pleased to introduce agenda item 15, which is outlined in document WPR/RC73/11. It presents progress reports under the 4 thematic priorities of For the Future vision, namely health security, including COVID-19 and antimicrobial resistance, non-communicable diseases and aging, climate change, the environment and health, reaching the unreached, and cross-cutting progress report advancing the For the Future vision. All progress reports will be considered together as mentioned by the chair. I'd now like to invite our technical directors leading the work under these areas to present the progress report. And I would like to start with progress report 15.5, advancing the For the Future vision. I would now like to hand over to Mr. Martin Taylor, Director, Division of Health Systems and Services, to introduce progress report 15.5, advancing the For the Future vision. Over to you, Martin.
Thank you very much, Corinne. Chair, distinguished representatives, I'm pleased to present for your consideration the progress report number 5, cross-cutting, advancing for the future vision in the Western Pacific region. The disruptions to health services caused by the COVID-19 pandemic are a reminder that the Western Pacific region needs to continue to strengthen health systems and, importantly, work beyond the health sector to advance health outcomes. Progress Report 5 provides an update on the region's implementation of 5 cross-cutting action agendas and frameworks endorsed by the Regional Committee that all collectively support the vision for the future. The Universal Health Coverage, Moving Towards Better Health Action Framework for the Western Pacific region was endorsed in 2015. In this past year, the meetings of the Universal Health Coverage Technical Advisory Group and the Technical Advisory Group Alliance continue to explore bringing together all our disease programs behind a common agenda to strengthen systems for UHC. The Regional Framework for Action on transitioning to integrated financing for priority public health services in the Western Pacific was endorsed in 2017. WHO has been supporting member states to ensure adequate funding for essential public health functions, analysis to support health financing strategies, and to improve public financial management. The Western Pacific Regional Action Agenda on regulatory strengthening, convergence, and cooperation for medicines and the health workforce was endorsed in 2017. WHO supported member states to build on the strong regulatory cooperation for COVID-19 vaccines to further deepen convergence and to use the WHO global benchmarking tool to guide regulatory strengthening for member states. The Action Framework for Safe and Affordable Surgery in the Western Pacific region was endorsed in 2020. We have supported a number of member states to implement the framework with subnational planning, reviews, and work to address critical bottlenecks, including improving sterilization practices. And the Regional Action Agenda on harnessing e-health for improved health service delivery in the Western Pacific was endorsed in 2018. WHO has supported development of national digital health strategies and has used the WHO Digital Health course to raise understanding of applications of digital tools to support public health goals. More information on WHO support to member states on these frameworks is outlined in Progress Report 15.5. The Regional Committee for the Western Pacific is requested to note the progress on advancing the vision for the future towards the healthiest and safest region. Thank you.
Thank you, Martin. I would now like to invite Dr. Babatunde Olowokure, Regional Emergency Director and Director of the Division of Health Security and Emergencies, to introduce the progress report on health security, including COVID-19 and antimicrobial resistance. Over to you, Babatunde.
Thank you very much, Corinne. Honorable Ministers, Chair, and distinguished guests, I am pleased to present the progress report on implementation of the For the Future thematic priority on health security, including antimicrobial resistance, or AMR. Recognized in For the Future and the WHO 13th General Program of Work, health security, including AMR, is a key priority for member states and WHO in the region and globally. The ongoing COVID-19 pandemic has highlighted the central role that health security plays, not only in health and well-being, but also in enabling societies to function, driving economic development, and achieving the Sustainable Development Goals. However, our work goes beyond COVID-19, and the report notes progress in strengthening health security through 4 key areas. Firstly, collective work across the region to strengthen public health capacities needed to prepare for and respond to public health emergencies and to implement the revised International Health Regulations 2005. And this has been achieved under the Asia-Pacific Strategy for Emerging Diseases and Public Health Emergencies, otherwise known as APSED-3. Secondly, the incorporation of disaster risk management into health systems to manage health-related risks and minimize the health-related consequences of emergencies, including natural disasters. Thirdly, implementation of the regional framework for action on food safety in the Western Pacific to ensure access to safe and nutritious food. And our final framework is the reinforcement of efforts to combat and contain AMR under the framework for accelerating action to fight antimicrobial resistance in the Western Pacific region. The Regional Committee for the Western Pacific is requested to note the progress made in each of these areas in regard to the implementation of the For the Future thematic priority on health security, including AMR. Thank you, Chair, and thank you, Corinne.
Thank you, Babatunde. I would now like to invite Dr. Hiro Okayasu, Director, Division of Healthy Environments and Population, to introduce the progress report on non-communicable diseases and aging. Over to you, Hiro.
Thank you very much. I'm pleased to present the progress report on implementation of For the Future thematic priorities on non-communicable diseases and aging. This year's progress report focuses specifically on progress in supporting member states in working towards a healthy, tobacco-free region and in addressing childhood obesity. It also presents an update on the work of the Technical Advisory Group on NCD prevention and control in our region. As discussed during the earlier session on NCD prevention and control, NCDs are one of the major health and development challenges of the 21st century. They account 87% of all deaths in the Western Pacific region, and then more than 1/3 of these diseases are premature. Most NCDs can be prevented through the population-wide control interventions that addresses common risk factors, such as smoking, unhealthy diets, and obesity, low level of physical activity amongst population of all ages, and excessive alcohol use. WHO intensified technical support to countries and areas for the expansion and strengthening of smoke-free environments, the promotion of physical measures to reduce tobacco affordability, the strengthening of tobacco cessation services, and the regulation of new and emerging nicotine and tobacco products. The unhealthy food environment negatively influences dietary patterns, contributing to increases in overweight and obesity in the region. Childhood obesity has skyrocketed in recent years, affecting nearly all countries and areas in the region. Following regional committee endorsement of the Regional Action Framework on protecting children from harmful impact of food marketing in the Western Pacific in 2019, WHO strengthened support for member states in their effort
to address childhood obesity through regulating food marketing, nutrition labeling, and physical policy. This includes support to convene a meeting to encourage member states to scale up efforts to tackle childhood obesity as part of their commitments to achieve the nutrition-related sustainable development goals and targets. To further strengthen the NCD agenda in the region, experts from the region reviewed the draft regional action framework for non-communicable disease prevention and control in the Western Pacific and provided strategic direction for the way forward during the NCD Technical Advisory Group meeting in July 2022. Experts emphasized in particular the importance of social and environmental factors in health, cross-sectoral efforts, and strengthening implementation both at national and subnational levels. The regional committee is invited to note the progress on the implementation of for the future thematic priorities on non-communicable diseases and aging. Thank you very much, Vivian.
Thank you, Hiro. I would now like to invite Dr. Mark Jacobs, WHO representative for the South Pacific and Director, Division of Pacific Technical Support, to introduce the progress report on climate change, the environment and health. Over to you, Mark.
Thank you, Corinne. Thank you, Chair. I'm pleased to present the progress report on implementation of the For the Future thematic priority on climate change, the environment and health. Climate change and environmental hazards, such as air pollution, exposure to hazardous chemicals, and the lack of safe water and proper sanitation, pose serious threats to the health of people in the Western Pacific region, contributing to the already heavy burden of communicable and non-communicable diseases. If left unaddressed, the impact of climate change and environmental hazards will pose even greater risks to the region's health and safety into the future. The Regional Committee is invited to note progress in the implementation of the For the Future thematic priority on climate change, the environment and health. Thank you, Chair.
Thank you, Mark. And finally, I would like to invite Dr. Tran Hong, Director, Division of Programs for Disease Control, to introduce a progress report on reaching the unreached.
Thank you very much, Corinne. Mr. Chair, distinguished delegates. I'm pleased to present the progress report on implementation of For the Future thematic priority on reaching the unreached in the Western Pacific region. Member states in the region have made significant progress in enhancing health systems for newborn care and in strengthening the control and elimination of communicable diseases such as tuberculosis, neglected tropical diseases, and vaccine-preventable diseases. The region has been implementing early essential newborn care in line with the action plan for healthy newborn infants in the Western Pacific region 2014-2020. The region will maintain the existing target until 2030, emphasizing strengthening health systems to reinforce quality improvement approaches among unreached and high-risk population, focusing on cesarean-section birth and preterm and low birth weight infants. WHO has been enhancing its support to member states by working collaboratively to restore ongoing immunization initiatives and programs amid the COVID-19 pandemic. In line with the regional strategic framework for vaccine-preventable diseases and immunization in the Western Pacific 2021-2030. At the same time, WHO has been working with member states to reach additional unreached population through COVID-19 vaccination responses and efforts to achieve and sustain the control and elimination of vaccine-preventable diseases. The region has made significant progress in controlling and eliminating neglected tropical diseases due to the continuous efforts of member states to decrease the disease burden. In addition, the region has been a pioneer among WHO regions in the progressive scale-up of annual mass drug administration, one of the most significant global public health achievements. In 2021, as its 72nd section, the Regional Committee endorsed the Western Pacific Regional Framework to NTB 2021-2030. Using 2015 data as the baseline, the region have achieved a 14% reduction in TB mortality and 6% reduction in TB incident by 2020. The region is making good progress in implementing the regional framework, notably by expanding rapid diagnostic tools, systematic case finding, and scaling up programmatic management of drug-resistant TB, including new drugs and shorter treatment regimes. The progress documented in the report, in line with the thematic priority of reaching the unreached, demonstrates collective efforts of member states and WHO in strengthening essential health services. The regional committee is requested to note progress in the implementation of for the future thematic priority on reaching the unreached. Thank you, Mr. Chairperson.
Thank you very much, Huang, and thanks again, colleagues. Mr. Chair, this concludes the introduction of progress reports on technical programs. Thank you, Mr. Chair.
Thank you, Dr. Capuano and colleagues. Ministers, Excellencies, I know it's almost 5 o'clock, but I ask your indulgence to continue for a few more minutes and take a couple of interventions before we close the day. Thank you. We will now hear from representatives who wish to speak on this item. Please indicate your wish to speak by pressing the button on your microphone if you are in the plenary, or by using the raise hand function on Zoom. Please speak slowly and directly into the microphone in 3 minutes. Thank you. Philippines, you have the floor, followed by China. Thank you.
Thank you, Chair. The Philippines notes with appreciation the progress report on the implementation of the future thematic priorities. The COVID-19 pandemic has illuminated gaps in the health security. This warrants a critical mindset and priority shifts to fill in. Few of the priority interventions identified were reinforcing intersectoral collaboration, strengthening management institutions for health, increasing investment in the health sector, ensuring delivery of the right care at the appropriate level, and caring for the health workers. In terms of climate change, environment, and health, the Philippines stewardship of the health sector's response to climate change is part of the country's journey in achieving universal health care and assures its continuing work towards green, safe, and climate-resilient health facility development. For this, we also appreciate the Secretariat's support in the development of the Green and Safe Health Facilities Manual and the Green Viability Assessment Tool. The Philippines also thanks the Secretariat for supporting the development of the country's National Environmental Health Action Plan, which was endorsed by the Interagency Committee on Environmental Health, composed of 12 national government agencies. This action plan includes key sectoral programs such as WASH, air quality, chemical safety, food safety, occupational health, solid waste management, and climate change. There are also other WHO project sites in the country to strengthen subnational capacities on testing of drinking water. In support of the global direction towards universal health care through strengthening health security and improving access to medicines, we recently launched the Philippine Medicines Policy 2022 to 2030, which draws heavily from the lessons learned from the COVID-19 pandemic. The Philippines will always endeavor to sustain our efforts to build a resilient health system aligned with the global agenda on health security. We stand ready to support the leadership of the WHO in strengthening the health security systems ready for the future pandemics and health emergencies. Thank you, Chair.
Thank you, Philippines. China, the floor is yours, followed by Japan. Thank you.
Thank you, Mr. Chair. China has noticed the relevant progress reports, and we appreciate the efforts made by the Secretariat. As the progress report has mentioned, over the past year, China and the WHO In particular, the 3 levels of WHO have made effective cooperation in various fields such as neonatal care, child obesity prevention, the tobacco control with digital technology, and financing for primary health care, as well as dealing with AMR. We highly appreciate the cooperation. China is ready to consolidate and strengthen our friendly cooperation with WHO and member states in fields like effective use of information technology, promoting healthy lifestyle, improving health environment, realizing healthy aging, and reach the unreached. We wish to strengthen our exchange, take reference from experience, and accelerate the realization of the Global Development Initiative, as well as the Triple Billion Goals and SDGs as expected. Thank you.
Thank you, China. Japan, you have the floor, followed by Malaysia.
Thank you, Mr. Chair. We thank the Secretary for its report. We commended the UPRO for its effort. Even though still responding to the COVID-19 pandemic, lessons learned from the COVID-19 have been applied and capacities to respond to infectious diseases have been improved. We found such application and improvement in setting up multi-source surveillance system, integrating COVID-19 surveillance innovation into routine influenza surveillance system, and building a regional pathogen diagnosis and surveillance system, such as the Western Pacific Region Emerging Molecular Pathogen Characterization Technologies, EMPACT. In addition, making steady progress in food safety should be commended, and Japan expects that mutual manuals for food safety should be finalized by the end of 2022 as planned. Regarding the AMR countermeasures, national action plans have been developed in many countries based on the WHO Global Action Plan, and it is important to follow up and ensure steady implementation. Surveillance of drug-resistant bacteria is also considered essential. Japan is supporting the development of surveillance systems in several countries in the Western Pacific region, and developing and strengthening of surveillance systems will be considered in more countries. It is important for the whole UPRO region to collaborate efforts to strengthen AMR measures, which will contribute to building better health security in the region. Regarding the nutrition issues, at the Tokyo Nutrition for Growth Summit in 2021, hosted by the government of Japan in December 2021, the double burden of malnutrition, of undernutrition that hinders growth and development, and overnutrition that causes non-communicable diseases, such as lifestyle diseases, became an issue for all nations, regardless of their development stage. At the discussion on the global nutrition in light of worsening situation affected by COVID-19, the Tokyo Compact on Global Nutrition for Growth was issued. The direction for the global society was presented to improve nutrition in the future. We hope that the Secretariat continues sharing progress on these thematic priorities to proceed further action of UPRO member states. I thank you.
Thank you, Japan. Malaysia, you have the floor.
Thank you, Mr. Chair. Malaysia thanks the WHO for the comprehensive progress report on the 5 technical programs and issues, and we take note of its contents. Regarding thematic priority 15.1, Malaysia is pleased to note the progress in implementing the For the Future thematic priority on health security, including COVID-19 and antimicrobial resistance. We thank and congratulate the WHO for its role in leading the global response to AMR containment, including supporting Malaysia in implementing the Malaysian Action Plan on AMR 2017-2021. Malaysia is finalizing its updated national action plan based on the local needs and recommendations by international bodies. Malaysia has expanded the antimicrobial stewardship program for health professionals to all private health facilities through the revised version of hospital accreditation standards. Meanwhile, the AMR awareness program has also been enhanced by focusing more on public engagement. Malaysia also participates in the global surveillance program of AMR and antimicrobial consumption following the WHO, WOAH, and FAO recommendations. Malaysia would like to express its support for the agenda for the action framework for safe and affordable surgery in the Western Pacific region 2021 to 2030. The Global Surgery Initiative, in tandem with the cluster hospital concept in Malaysia, has also greatly improved both accessibility and utilization of healthcare services and training existing healthcare personnel. Regarding the WHO Global Benchmarking Tool Assessment on item 2.3 entitled Strengthening National Regulatory System Through Stepwise Convergence and Cooperation, Malaysia applauds Vietnam and Singapore for achieving maturity levels 3 and 4, respectively, during the assessment by WHO. Malaysia is currently working on finalizing the WHO GBT self-assessment, which is the first step in preparing for the evaluation by WHO assessors. We look forward to completing the self-assessment by December 2022, and we will proceed with the physical assessment by the end of 2023 to early 2024, depending on WHO's audit schedule. Malaysia will continue to stay committed to all the vital technical program areas as we strive to make the Western Pacific region the safest and healthiest region in the world. Thank you.
Thank you, Malaysia. Ministers, Excellencies, I think we come to the end of day 4. We will suspend this item 15 on progress report, and we'll continue with the intervention tomorrow morning at 9 o'clock. Thank you very much, and we'll see you tomorrow at 9 a.m. Thank you.